Aloha, and welcome to this presentation of the Vegan Society of Hawaii. We are thrilled to welcome today Peter Rogers, MD. Dr. Peter Rogers is a neuroradiologist and author, also known as the Spartan Vegan, who received his bachelor's degree in biology at the top of his class from Stanford University, his medical degree from the University of Illinois College of Medicine, and a fellowship in imaging-guided surgery or interventional radiology from Harvard Medical School. His presentation today is Save Your Brain, Why Everything You Know About Dementia is Wrong. Aloha, Dr. Rogers.
Hi. Okay, I got my slides here. Let me start the slideshow for this lecture here at the Vegan Society of Hawaii. The old view of health was just eat a low-fat vegan diet, low sodium, everything will be fine. I would add nowadays it's becoming more complex. You also want to learn something about the common toxins and how to avoid them. So here is you like when you walk into any museum or a tourist place and they say, here's the map of where you're going. Basically, what most people do is they continue to eat a poor diet, lots of meat, processed food and oils and dairy, and they just get sicker and sicker. The older you get, the more fragile you get. So the more you need to get your act together or you're going to be prone to health problems. And they take pill after pill, drug after drug. The drugs don't work so well quite often. And they get worse. They end up going for surgeries, open heart surgery and all these other surgeries. And then bye-bye money and dead around 70, if not earlier. So the smart move is optimize your diet. Best diet is low fat, low sodium, 100% vegan, whole foods, if possible, organic with no oils. And then we'll learn a little bit about some of the common toxins. You want to avoid them. If you do that, you got a good chance on average to live into your late 80s, maybe 90 nowadays. So I think that's the goal. Just to give you an example of epidemiology in northern Mexico, for example. In 1848 was a Mexican-American War, and what is now called Arizona was sort of pulled into the United States. And the population there that used to be together with the Tarahumara is the Pima. And the Pima population eats the Western diet, standard American diet, the SAD diet. They've got tons and tons of disease. They're overweight. They often have gallstones. They go for open heart surgeries. They got all the common surgical landmarks on their bellies and their chest. Appendectomy, sigmoid colon resection for diverticulitis, diabetes, peripheral vascular disease. They lose their legs for amputations. So they've got terrible disease. Versus the Tarahumara, who kept their traditional ways in northern Mexico. They're right around the Sierra Madre Mountains, like the Copper Canyon area. They eat lots of corn, some beans, local greens. They're world famous as being ultra marathoners. They can run 100 miles in 2 days, and it's like every guy in town can do that, not just the fast guy. So what I'm trying to say is, genetically, this is the same population. Just one of them stuck to a traditional healthy diet. The other one ate this modern processed food stuff. It makes people fat and sick. In my job as a neuroradiologist, I see tons and tons of cognitively impaired and demented people with memory loss, and I decided to try to make sense of it because the incidence is going up. And what I noticed is almost all of them have diabetes or hypertension, and most of them coronary artery disease. I also noticed they very commonly have had cataract surgery on one or both sides, and most of them also have poor dentition, poor teeth, several missing teeth. Of these, if they only have one or the other, diabetes or hypertension, they'll very often, sometimes I think it's not even in the chart, but they actually do have both hypertension and diabetes. I can only go by what's in the medical chart for these patients. Okay, some people have called so-called Alzheimer's as type 3 diabetes. One thing to be aware of is low blood sugar is more dangerous than high blood sugar, and I actually think low blood pressure is more dangerous than high blood pressure most of the time. I'll explain why that is. We're going to get into what that's all about. Most of them are overweight, not all. Lots of them have sleep apnea. A lot of smokers, alcoholics, and whatnot, and some previous strokes. But the point of this slide was the vast majority of patients have diabetes and hypertension. Those are the gateway diseases that push the development of atherosclerosis, which then plugs up the arteries in the brain and the rest of the body, the heart. Traumatic brain injury certainly predisposes a person to cognitive impairment. Everybody knows about football and boxing and MMA potentially causing brain damage, but what a lot of people don't realize, soccer does too. When people are hitting the ball with their head for soccer, that's not a good thing. I would not recommend allowing your children to play soccer because even if the coach says, I'll try to not get them to do heading, they're going to be competitive around their friends. They're probably going to do it. Parkinson's disease, you got to watch out for chemicals like the dry cleaning TCE. trichloroethylene. Women with hysterectomies at a young age, before 35 years of age, most commonly for fibroids, they have a markedly increased incidence of severe hypertension and hypertensive microhemorrhages into the brain and early onset dementia. Whenever I get a demented female, relatively young age, 50 to 65, if she doesn't fit the usual suspects type of pattern, alcohol, substance abuse, that sort of stuff, I look in the surgical note, and very often it's because she had a hysterectomy. It's because when you menstruate, you lower your hematocrit, which makes your blood thinner, and it lowers your blood pressure, and it decreases the risk of atherosclerosis, of forming clots. All the stuff people talk about for reversible causes of dementia is actually really rare, because you'll see if you open up a book, reversible dementia, resectable benign brain tumor, meningioma. I almost never see that. Once every 10, 15 years do I see that as a cause of cognitive impairment. Treatable communicating hydrocephalus. It's actually rare that that causes cognitive impairment. Yes, I've seen it. Yes, I've seen it be reversed, but it's rare. I'll see maybe one good case a year. Subdural hematomas causing cognitive impairment, that's also quite rare in the elderly population. So that's not where you want to put your money. Where you want to focus is on preventing diabetes and hypertension. That's your best chance. There's also the case of infections, but these things are rare. If you eat uncooked pork, that'll increase your risk of getting cysticercosis, a pork tapeworm in the brain, but that's pretty rare. I barely ever see that. They talked about syphilis and Lyme diseases, infections that can cause that. Super, super rare. Chris Christopherson, the country music singer, he was told he had Alzheimer's dementia. Then they treated him for Lyme disease and he got better. So he's one really rare case of it. But I'm looking most of the time at a clean looking brain that's just shrunken. It's atrophic. There's nothing else really going on with it. I'll explain why that is in just a moment. These other infections are pretty rare. People talk about mad cow disease, bovine spongiform encephalopathy. I almost never see that. Again, I see about one case every 10 to 15 years. That's not a common cause. I sometimes see autoimmune cognitive impairment. Usually that's in the setting of multiple sclerosis, very rarely with lupus. You can get other things. You can have hypothyroidism. Usually they've got that figured out. B12 deficiency, they usually figure that out pretty quick. Thiamine deficiency, they usually figure that out pretty quick. Same thing with folate deficiency. Iron overload is kind of insidious, and that can be missed. So it's good to be aware of it. You don't want to be iron overloaded. You can check your serum ferritin. Let's see. I'm going to get into some of the complex stuff. One of the things I want to show you is that in my experience, Western patients, they all think hypertension is normal. Hypertension is considered normal aging. I got news for you. Hypertension is not normal aging. In blacks, they have hypertension off the charts. And when I was in med school, they're like, oh, well, nobody knows why. Maybe they're salt sensitive. That's all nonsense. And I'm going to show you, here's a paper. This is a paper. The author's name is Donison. He's a physician from England. He wrote this paper in 1929. It's in the Lancet Journal. It's called Blood Pressure in the African Native. It's bearing upon the etiology of hyperpaesia. That's just a fancy word for hypertension and atherosclerosis. So what's interesting about it, in adult men, they checked 1,800 consecutive admissions. No case of raised blood pressure was encountered. None. Zero. 1,800 patients, because they ate a plant-based diet back in that time. This is in Kenya. And they also then measured what was the average blood pressure in persons about the age of 60 years of age in a European man versus in a man from Kenya. And the average European man was eating sort of an Anglicized diet, had an average blood pressure 140/90, sort of a mild hypertension, versus the average 60-year-old man from Kenya had a blood pressure 105/67. So that's totally normal. That's the same as like a teenager, meaning that if you eat a plant-based diet your entire life, you'll have the same blood pressure as a teenager as you will in your 60s and 70s. So the point I'm saying is hypertension is not inevitable. And quite often when you figure out the cause of something, you then know the cure of it. Stop eating the Western diet. Eat more of a plant-based diet. Okay, I also want to show you, people also think diabetes is almost inevitable. I wouldn't even look on the chart. If you just told me 60, I got to go do a procedure in that patient in the other room, 60-year-old patient, I would automatically assume the patient was hypertensive and pre-diabetic or diabetic and had coronary artery disease. I would not even look on the chart. I would just assume that. And what I'm trying to tell you is type 2 diabetes is easy to prevent. Here's a book by Roy Taylor. He basically had all of his patients lose weight, and all the patients who lost 30 pounds or more, they all reversed their type 2 diabetes. If they had had it less than 4 years, meaning that they probably still had the beta cells of their pancreas, which produce the insulin, were still intact. Walter Kempner used to cure type 2 diabetes all the time. What I see most type 2 diabetics doing is they'll say it's under control, meaning that their blood glucose levels are not that bad, their hemoglobin A1C is not that bad. But I like the quote of Dr. John McDougall. He said, instead of trying to control your diabetes with medications, why don't you try to cure it with a healthy diet? is usually pretty easy to do. The longer you wait, the more likely you'll have damage to the pancreas and lose the ability to produce insulin, and at which point it becomes irreversible. I briefly want to mention two types of atherosclerosis. The most common type of atherosclerosis in the Western world is what we call like a high-fat diet atherosclerosis. Number one important spot is the coronary artery disease of the heart, and then number two would be the carotid artery in the neck. But there's another type of atherosclerosis that has been called Asian atherosclerosis, especially after the population of Japan, like from the 1960s. So they were eating a relatively low-fat diet, a lot of rice. White rice is only 1% of calories from fat. But what was unique about their diet is they were eating tons of sodium, like about 12 grams a day, some of them 14 grams a day. They were also smoking a lot of cigarettes. Both of those things will cause vasoconstriction and raise blood pressure. So isolated hypertension without fat will have a tendency to cause intracranial atherosclerosis. If you do both things, eat a high-fat diet and you smoke and you eat tons of salt, you'll get both. But still, this is sort of the two characteristic patterns of atherosclerosis. Now, here's a chart looking at diets just to show you what happens to people. So the average American's eating a real high-fat diet, and they plug up their coronaries. Most common cause of death is myocardial infarction. What's not so widely talked about is the fact that high-fat diets stick the red blood cells together. I'll explain why that happens, but they do. It's also sometimes called blood sludge, and that leads to decreased oxygen delivery to the tissues. So you get hypoxia, a lack of oxygen in your tissues. Well, that increases the risk of cancer. And that's kind of interesting because the Japanese smoked a ton, and so did the population in Papua New Guinea. But because they ate high-fat diets, they had much, much, much lower incidence of lung cancer than the Americans did, even if they were smoking more. Like, for example, Papua New Guinea, they had like over 6 times less lung cancer than the Americans, despite the fact they were smoking a lot. They were at that time eating about 93% of their calories from sweet potatoes. Sweet potatoes have only 1% of calories from fat, same thing as regular potatoes. And it's thought that that was the major protective factor to lower their risk of getting cancer. And that's sort of all types of cancer besides just lung cancer. The East Asian, Japan, Korea, China diet, we talked about that. Their problem was especially the high sodium because they were actually eating a pretty good diet, let's say before 1970, 1975. Nowadays, more and more people in Japan, for example, they're eating higher fat diets with more oil in their foods, more Western food, meat and dairy. And because of that, they had an increased rate of dementia. I'm going to talk about the guy who figured that out. We'll get to him in a little while later. That's Dr. Yamashima. If you look at the diet from the people from India, you see all these people from India, they're kind of skinny. They'll tell you they're a vegetarian. They look pretty healthy. But then I was surprised to discover that tons of them have lots of problems with atherosclerosis and coronary artery disease. And I'm like, well, how could that be? You're skinny vegetarians. But as it turns out, a lot of them eat tons of fried food. And again, going to the Yamashima theory, which I'm going to talk about, that appears to be the major causative factor. There's minor causative factors. They eat the butter, dairy, the ghee, and some of them have congenitally narrow coronary arteries, but the money is they're eating tons of fried food. I got a bunch of friends from India, and that's what they tell me as well. And then what's the best way to go? Low fat, low sodium, vegan with no oil. It has low risk of everything. Very low risks of cancer, low risk of stroke, low risk of heart attack, hypertension, diabetes. I mean, why wouldn't you want to have low risk of all the bad common diseases? Here's a little bit about migration studies, travel studies. The population of Okinawa was healthier than the population of Japan. Japan's population was pretty healthy, but Okinawa was even more healthy, and it's thought because they didn't add so much salt to their food. They were especially healthy back in the day when they ate more sweet potatoes. Okinawa now has a bunch of fast food restaurants, and they're not nearly as healthy as they used to be. They used to walk a lot too, like walk to their farms. Okay, when the Japanese would migrate to Hawaii, they would tend to have their diet get more westernized, meaning more meat, more oil, more dairy. And especially as they would subsequently move to California, they get further more westernized, and then their health advantages would start to drop off. The point of all this is it's not genetic, because it's always the same pattern. As a person eats more meat, dairy, and oils, they start having worse health problems. The population that was healthiest in the Los Angeles area was the Loma Linda, because they were the Seventh-day Adventists, and it was part of their religion to be vegetarians and vegans, and that kept them relatively healthy, especially the vegan subset of their population was healthier. And this is just one more example of epidemiology. The Yanomamo in South America in the Amazon jungle, sort of on the border of Venezuela and Brazil. Once again, they'd have the same blood pressure for life as a teenager, as an elderly, like about 100 over 60, women 95 over 60. They don't add any salt to their food. They eat primarily plant foods. So that'll do it. Now, when we talk about dementia, one of the points I want to make is I don't even like the word Alzheimer's. Alzheimer's was in the early 1900s diagnosed, and there's a genetic subset of Alzheimer's that's quite rare. But then an extrapolation was made to claim that the genetic subset was the same as the sporadic sort of random onset type of dementia. And then they wanted to get more funding, and it got totally exaggerated how common this rare genetic form of so-called Alzheimer's disease was. I tell you that because I just use the word dementia. For example, with Alzheimer's, what question can you ask the patient to diagnose it? There is no question. What physical exam finding? Can you put a stethoscope on them? No, there's no physical exam finding. Is there a reliable blood test? No. Are the brain MRIs reliable? No. I'm a neuroradiologist is one of the things I do, and I can tell you, I almost never see that characteristic pattern of parietal atrophy with associated medial temporal lobe atrophy. The imaging is not that good at all for Alzheimer's. And then you say, well, they can diagnose it at autopsy. It turns out if they don't know the history in advance, they also have a hard time diagnosing it at autopsy. People who they didn't think had it will turn out to have the characteristic extracellular senile plaques, intracellular neurofibrillary tangles. The autopsy even is not that useful. And they don't have any treatment that works. So what kind of a disease is that? You can't diagnose it when the patient's alive. You can't, clearly diagnose it when they're dead, and you have no treatment. That's not helping you much. Plus, when you talk about Alzheimer's, it leaves the patient hopeless. What are they going to do? There's nothing they could do, in a sense, to avoid Alzheimer's based on the way it's typically taught and conceived. And what I'm trying to tell you is what you want is an explanation of disease causation that is useful, that is true, and that gives you a way to intervene and improve your risk, to lower your risk of getting dementia. Here's an entire book, How Not to Study Disease. And there's been other books written about how the research in Alzheimer's, it's some of the worst research in all of science. It's really kind of has become about trying to find a billion-dollar drug to sell and make money. So you'll be amazed at how bogus the research is for Alzheimer's. All right, now here's what we're going to get into. I'm going to explain to you a whole bunch of risk factors. This slide is just to give you a taste of what's to come. But what I'm saying is there's about 70 different things you can pay attention. And the way you could kind of avoid almost all of them is just by being sort of a minimalist. Don't go looking for extra chemicals. Avoid processed foods. I'll explain this in more detail as we go along. And when you talk about food, a good rule of thumb is all the good stuff is in plants. All the bad stuff is in meat and processed foods. And that sounds like an exaggeration, but it's not. The only thing plants are missing is they're missing some B12 because it's made by bacteria. That's where the animals get them from, but the animal will still have some in its tissue. So the only supplement I personally take is I take a B12 methylcobalamin type of form. But plants, they got the fiber. Fiber protects your gut, but it also protects your brain. It protects your blood-brain barrier. We're going to talk about that later. You got the vasodilators like potassium, magnesium, and plant nitrates. Those keep your arteries open. You got the antioxidants like vitamin C and the other ones, which help prevent oxidative stress, the inflammatory chemical reactions that destroy tissue, and they also help you to handle your heavy metals for detoxification. They're alkaline, so you avoid the metabolic acidosis induced by the characteristic features of animal protein. And you kind of want to be low in protein. We're not going to go into too much detail on that, but there's reasons for that. If you take an animal and you feed them a low protein diet, they live longer. If you calorie restrict them, they live longer. But nobody wants to calorie restrict. That means starving. But you can protein restrict and get the same effect, especially methionine restrict. Complex carbohydrates are great food to eat. Those are the starches. That's things like potatoes, sweet potatoes, rice, some beans, not too much, but some beans, quinoa, oatmeal, single ingredient wheat. Some people are sensitive to wheat, but others can eat it. And you don't want to be iron overloaded. There's good reasons. I'll explain why that is later. The phosphorus in plants tends to be bound to phytates. It's not so widely bioavailable and absorbed. I like low-fat plant foods, and especially low-protein, low-fat plant foods. I'm not a fan of high-fat plant foods. And then meat's got tons of problems. Saturated fat's like one of the worst types of fat. Animal protein's much more acidic with the methionine. The leucine is a branched-chain amino acid that activates mTOR, which accelerates cell replication. You don't want to accelerate cell replication because that increases your risk of cancer. It also accelerates the rate at which cells divide, meaning that you reach the Hayflick limit more quickly. That's the limit of the number of times a cell can divide. Leonard Hayflick was a research scientist working with human tissue cultures, and he found once they reach about 60 cell divisions, the cells just die. Every time a cell replicates, it shortens its chromosomes because the DNA polymerase can't get to the end of the chromosome. Eventually, it shortens into genes that the cell needs to live, so the cell dies. So what I'm basically saying is it accelerates aging. You don't want that. There's more inflammation with the arachidonic acid. There's a whole bunch of problems. They give them estrogenic chemicals quite often, the animals in CAFO for concentrated animal feedlot organizations. And so those make a person gain weight. Estrogen's a fat storage hormone. It sort of tells a woman's body to hold on to more weight. The baby might need it for energy. And when you eat all these estrogenic chemicals, it predisposes to obesity. It's often fried. Fried food, we'll get into Yamashita theory later, but that predisposes to obesity and diabetes and other problems and cognitive impairment. There's a bunch of other problems with me too. I won't even go into it now. It's too much. As far as MSG means monosodium glutamate, and that used to be used a lot as a flavoring agent. Nowadays, they don't even use that as much. What they're using nowadays is something related to it. Manufactured free glutamate, MFG. And it's really the G is the only thing that matters for glutamate because it's an excitatory neurotransmitter. 90% of your cerebral cortex of your brain uses glutamate as the excitatory neurotransmitter. It's like walking into a room and flipping a light on. But our ancestors worried about starving to death. So for them to find a high protein source of food was a good thing because they were afraid they're going to starve to death. And so you got taste receptors for that, the umami taste receptors in your mouth and on your throat. But nowadays, starvation isn't the main problem for people. The main problem for people is getting too much food. So what they do is the food companies, they do research and they test how to reach the bliss point. Just the right amount of glutamate in there, the right amount of salt, the right amount of fat, the mouse texture, throw in some sweetener like high fructose corn syrup. And they test people what gets them to want to eat the most and keep buying more of it. And these are called hyperpalatable, these processed foods. Here's a picture of a neuron, a brain cell, what it looks like. So this is the first one. This is called the presynaptic neuron. This is the synapse. And then this is the postsynaptic neuron. NT stands for neurotransmitter. A neurotransmitter will diffuse across this cleft and activate the postsynaptic neuron. So incoming messages come in here through the dendrites. Dendrite means like a tree because these look like a tree branches sticking up. Incoming message will come. If this cell gets activated, it'll fire an action potential. It'll travel down the axon, reach the axon terminal, and it'll then cause release of the neurotransmitter. And that will then activate the postsynaptic neuron. In a little more detail, this is showing that the action potential is primarily conducted by sodium, but once it reaches the axon terminal, that will open up the VGCC. That's voltage-gated calcium channel. And once the calcium floods into the synaptic terminal, it will then cause the neurotransmitter vesicles to diffuse to the synaptic cleft, release the neurotransmitter. Neurotransmitter will diffuse across to the postsynaptic neuron, and it'll activate it if it's an excitatory neurotransmitter like glutamate. That's real important to get, that calcium activates neurotransmitter release. You need to know that because that's going to be a big deal. Now, just to show you a little more complicated drawing of neurotransmission, this is again showing the glutamate neurotransmitter vesicle merging with the presynaptic neurons, synaptic cleft membrane. The glutamate's released into the synaptic cleft, binds to a postsynaptic receptor, and it activates the postsynaptic neuron. The point of this slide was to show you that other things will do that. Cortisol will do that. Cortisol is the hormone of stress. It will stimulate the release of glutamate. But guess what? If you're sleep deprived, that will have the same effect. If you drink caffeine, it'll have the same effect. That's why I think it is best to avoid caffeine because caffeine has a long half-life, about 6 to 8 hours. So I don't recommend coffee or tea. Even if you drink it in the morning, there's still some of that on board at night and it can get you to not sleep as deeply. And a lot of people say, I'm stressed out, I need a cup of coffee. And I think that's silly because you're just increasing the same hormones, cortisol and catecholamines. The catecholamines refers to adrenaline and noradrenaline. They're also called epinephrine and norepinephrine. So what I'm basically saying is most people need to calm their brains down if they want optimal cognitive function. And you don't want to overwork your neurons. Your neurons have to produce a lot of energy in order to be this active. And if you overstimulate them, you can, in a sense, work them to death. And I will explain what that means in a moment. Now, here's just an example of MFG. I referred to this a moment ago, but just to show you what it looks like in real life. You've got a protein, which is like a necklace with a string of beads. And each bead is an individual amino acid that makes up the protein. I put G for glutamate. And so what the companies do is they take a protein which intrinsically has a lot of glutamates in it, and then they start processing it. They can ferment it, they can do separation procedures, hydrolysis procedures, extraction procedures, enzymatic lysis procedures, ultrapasteurization. All of these things break it into individual amino acids, and that frees up the glutamate. So that's what manufactured free glutamate is. It's manufactured, done in a factory processing plant. It's free because individual glutamates are free. The danger of this is the body has the ability in the gut lining to sequester glutamate because it doesn't want this excitatory neurotransmitter floating all over the place and potentially activating neurons. But you can overwhelm the gut barrier and get too much glutamate in the blood, and that can activate neurons. And then people say, well, you have an intact blood-brain barrier. That's not necessarily true. Around the third ventricle, they're called circumventricular organs. They're chemical sensors, chemosensors, and they do not have a blood-brain barrier. They can be overactivated by glutamate. Plus, people often have little areas of breakdown in their blood-brain barrier due to like mini strokes, traumatic brain injury, old strokes, old traumatic brain injury, etc. And there's other reasons I'm going to get into in a moment that will explain why you can have areas of non-functioning or poorly functioning blood-brain barrier. A little bit about how the brain works. There's something called the three-part brain of MacLean. MacLean was a Harvard neuroanatomist, and he said you can think of the brain as being in three parts. The first one is sort of the brainstem, and that connecting up with the spinal cord. He called that the reptile brain. The reptile brain is very simple. A reptile doesn't have to raise its kids. It just lays an egg and it can walk away. And it just wants food, basically. So it's real simple. These are to maintain your heart rate, things that are done subconsciously, to maintain the heart rate, for example, to maintain a blood pressure. So that's the reptile brain. Then built on top of that is what is called the mammal brain. It's also called the limbic brain because it's primarily in the middle of the brain. Limbic means edge, like the middle edge of the brain. And that includes the cingulate gyrus, and that will continue down into the medial temporal lobe. And that will be part of your memory center, including your hippocampus in the medial temporal lobe. And then on top of that is the cerebral cortex. This is more of the primate brain or the human brain. And the more anterior you go, the more abstract the thinking, the more unique to the individual personality. What's the relevance of all this? When you're stressed out, you tend to lower blood flow to your frontal lobes, and your thinking becomes more emotional, more impulsive. So let's say you're talking to your boyfriend, girlfriend, husband, wife, and you can sometimes say, oh, I'm kind of stressed out, I'm sleep deprived, I had too much caffeine, I don't want to say something impulsive that I would prefer that I hadn't said. So you just catch yourself and say, okay, you know what? Let me wait till tomorrow when I'm in a more thoughtful mood before I open my mouth and don't say anything I might regret. Okay. Anyways, as far as the number of neurons in the brain, about 70% of them are in the cerebellum. And that's because you need fine coordination. Like just to write your name requires a lot of coordination. And the cerebellum is especially for motor coordination. It's got a lot of short interneurons to fine tune everything. And that's also why there's something called Moravec's paradox, meaning that the computer programmers could get a calculator to do mathematics and calculus back in the 1950s. But they're getting better at robotics, but it takes tons more computer processing power and sophistication to handle coordinated, sophisticated movement than it does what we would consider complex thinking. That's also why exercise is so good for you, because when you exercise, it's one of the best things you could do to age well. You have to use a tremendous large number of neurons to exercise. And I like a quote by Voltaire. There's a quote by Voltaire, the French writer. He said, why do animals have brains, but plants do not? It's because animals move. And as soon as you move, you have to do a lot of things. You have to make a value judgment. You have to pick a destination. I see a fruit tree over there. I'm hungry. I'm going to go get some fruit to eat. Oh, there's a bunch of coyotes over there. I don't want them to bite me. I'm going to avoid them. You have to navigate there. You have to avoid obstacles in your path. You have to have a memory to get back where you came from. So you have to do a lot of thinking to start moving. So again, moving really uses a lot of your brain and helps keep it active. One of the best things is dancing. Gosh, they have some Parkinson's patients do dancing because then you have to have social interaction with movement. That's a lot of stuff. That's a big workout for the brain. I won't go too much into this right brain, left brain stuff, but in general, think of left brain as logical, precise, kind of like the brain you use for school and for work, versus your right brain is more for a lot of the fun things. It's intuitive. It's like singing and metaphor. So left brain, they characteristically say is language, but there's a component of language that's right brain, more along metaphor, telling jokes, understanding jokes. Some people have a stroke and they can't talk regular, but they can still sing or hum things. And it's also the type of logic. The left brain is more deductive logic. You have all the information like an Aristotelian syllogism. All men are mortal, Socrates is a man, therefore Socrates is mortal, that type of thinking. Versus the right brain is more inductive logic, paying attention to a bunch of different things and consilience. All of these things seem to suggest this. Each one by itself is minor, but together in total, they mean a lot. That type of thinking, inductive logic. Oh, by the way, how do we map cognitive space? Well, first of all, let me tell you how we map time. I can actually go back to the previous slide to show you how we map time. We map time through the middle of the brain. That's called the default mode network. If you were sitting on a functional MRI table and you had your eyes closed, and I said, what you thinking about? Most people would say a relationship. They're thinking about their boyfriend, girlfriend, husband, wife, or whatever. Yesterday, she's a little mad at me because I didn't want to go to the movie. I had to study for school, but I'll take her on this weekend and we'll have a good time, so everything will be fine. So you're traveling back into the past, what happened, and you're making a judgment about the future. So that's how you time travel through the middle of the brain. The middle of the brain here, I'm now referring to what is called the default mode network, meaning that we default to it when we're not doing anything else. And you travel back and forth between past and future, past and future. The relevance is on the outside of the brain. I'll show you the next slide. Here's the outer surface of the brain. The outer surface of the brain is more where we have the task-based network, and that's to get things done. And so what that means is the task-based network of getting something done in the present moment, we have to focus on the moment. We're in the moment. And you can only think about one thing at a time with your conscious brain. Your subconscious mind can think of tons of things at the same time, but your conscious mind can only be aware and focused on one thing at a time. So a lot of times if a person's unhappy, they're sad, they're depressed or whatever, it's good to just get them busy doing something, exercising or doing something else, and because then they get into the moment, into the present. So that's how we function in the present. All right, then the next thing I want to talk about is how does the brain map cognitive space? And the way we map cognitive space is through a system of categories. By comparisons, by metaphors, by analogies, similes and whatnot. So that is a dog because it says bow wow. That is a cat because it says meow. And we sort of have all these classification systems, and that's how we map everything out and have everything located in our mind. And so whenever you learn something new, you just ask yourself if it's important to you. Do I want to remember this a week from now, a month from now, a year from now, et cetera? And if you do, you might feel, sometimes you automatically feel it in your gut that you will, but other times you can start comparing it to things, making metaphors, word associations, and you're just connecting it to more things in your brain with these comparative analogies, and it'll stick in your brain much better that way. There's no lymphatics in the center of the brain, but there are lymphatics in the periphery of the brain. It's called the meninges, meaning the coverings of the brain, and we're going to talk about that. That's going to relate to sleeping because it cleans your brain at night while you're asleep. You also have the venous system on the brain. They're small penetrating veins, but you got these big sinuses. Those are big honking veins on the outer surface of the brain. This right here is called the hippocampus, and this is the main site for the memory center. What neuroscience university has the fattest students? The hippocampus. Okay, that's a neuroscience joke. All right, so anyways, the gray matter is on the periphery of the brain. That's called the cortex. Cortex in Latin means bark, like the bark of a tree. So it's the outer surface of the brain, and that's where all the neuron cell bodies are. That's where their nucleus is, their DNA and all that stuff, and that's where the highest rates of metabolic function are. And then you have some deep gray matter nuclei in the center of the brain. This is called the basal ganglia area. These are the cerebral ventricles, the body of the lateral ventricles. At that level, that's going to be called the corona radiata, and above that's called the centrum semiovale because it's in the center and it's shaped like an oval if you look at it in a transverse section. The reason I mentioned those lymphatics a moment ago was that at night, your brain goes offline and it cleans itself. Your brain cannot go offline while you're awake because you have to maintain precise ionic gradients. Your brain cells are like electricity. So at night, though, your brain cells are asleep. You can turn them off in a sense, and you can pump out the waste products. And then you open up the spaces around the neurons, perivascular spaces, and cerebral spinal fluid flows over the neurons, and it rinses away the waste products from the arterial side to the venous sides. That's a combination of glial cells. Those are support cells in the neuron, kind of like the mama cells. They help the neurons. And then taking the waste to the lymphatic system. So it's called the glial lymphatic system or glymphatic system. And the point of all this is that your brain cleans itself at night while you are asleep. It cannot clean itself in the day while you're awake because it has to keep all these spaces tight, keep these neurons, in a sense, dry, if you will, meaning that their ionic gradients have to be precise and stable in order for the neurons to be able to fire electrical impulses. So at night, they clean themselves. And what that means is in the morning, you're smartest. And it makes sense. After you eat a big meal in the day, you don't need to be so smart. You can go to sleep. The time you need to be smart is when you wake up in the morning and you're hungry, break fast. You broke your fast from overnight. You got to go find some food. I want you to be aware of this guy here, Jack Delatorre. This guy did some incredibly wonderful research work to really make sense out of dementia. And his findings totally match what I have seen looking at brains. This is his book, Alzheimer's Turning Point. It's a great book. What did this guy do? He was out in Texas. He was a PhD research guy. He tied off the carotid artery in a mouse, and he found that middle-aged and older mice would become demented 2 months later. He did all kinds of variations on this. He would tie off the carotids on both sides, also tie off the vertebral arteries. Carotids are the blood supply of the anterior part of the brain. Vertebral arteries are the blood supply of the posterior brain. Carotids are the most important. They're bigger, much bigger vessel. Anyways, 2 months later, demented mouse. And he called this cerebral hypoperfusion. So perfusion means blood flow, and hypo means under supply, decreased blood flow. So cerebral hypoperfusion. And what he did, by the way, too, is he did autopsies on the mice. And when he looked at their brains, at first we were expecting a big stroke. But then when he looked at the mouse, there was no stroke. There was just a shrunken brain. The word for shrinking is atrophy. So he just had an atrophic brain on the side where he tied off the carotid. Very interesting. And then at first he thought, well, is that important? Maybe it's not that important. Not that many people have an occluded carotid artery or even a high-grade stenosis, let's say more than 70%. Most people don't. But you started thinking about it and you go, gee, how many people have atrial fibrillation and abnormal rhythm of the heart? Tons of people have AFib. How many people have congestive heart failure? Or you have decreased pumping power from the heart, ejection fraction, let's say below 45. Tons of people have that. How many people have obstructive sleep apnea? Lots of people. How many people have overtreated hypertension that drops their pressure too low? Lots of people. All of these things can cause dementia. Why do you have a blood pressure? To get blood to the top of your brain. It's the farthest thing away going against gravity in your body is to get blood flow to the top of your brain. So if you overtreat the hypertension, drop the pressure too low, you underperfuse the brain and you're like the mouse. So I made up the word mouse equivalence. So anything that drops your pressure too low, that's a mouse equivalent, can cause cerebral hypoperfusion. Lots of people got aortic stenosis, cardiac valve disease, aortic valve, aortic stenosis, aortic regurgitation. When people go for open heart surgery, they often run their blood pressure really low. My father went for that. That was before I knew that much. It was about 30 years ago, before I knew that much about the brain and what causes dementia. And I told him to go vegan, but I didn't know enough to pressure him. He got pressured by the surgeon and the cardiologist to go for open heart surgery. Anyways, I stayed with them in the ICU. You should always stay with your family member if they're in the intensive care unit. And they were running his pressure like 90/60. I called the anesthesiologist and said, why are you running his pressure so low? We don't want him to bleed. It is anastomosis, the plug-in sites for the graft in the heart from the coronary arteries and from the aorta. And I'm like, well, I don't want him to stroke. So he came through it fine, but I think my dad was a doctor and he was a pretty healthy guy, actually. So I think he's about the healthiest cabbage patient they're ever going to have. But that's why you hear about pump head. A lot of patients have cognitive impairment after open heart surgery. And I think that's the main reason why. Some people say, oh, it's because they embolize atherosclerotic debris or air bubbles intraoperative. And I'm going to tell you, I think it's post-op hypotension that is probably doing it more than anything else. Severe anemia can decrease oxygen delivery. So anyways, the concept of mouse equivalence and cerebral hypoperfusion, that's very important to get. Now, here's how it looks in a regular person. Here's the carotid artery coming up into the brain. It's then going to bifurcate. This is the middle cerebral artery. It bifurcates along the lateral surface of the brain. Oops, I didn't mean to do that. Let me go back. And there's also an anterior cerebral artery that goes down the middle. I didn't draw because it would be too complicated. But here's the point I want to make. When blood pressure is too high, it'll sometimes shear off the origin of one of these arteries here that go to the basal ganglia. That's called lenticulostriates. And you can get what's called a lacunar infarct. Lacunar means hole, a little tiny hole in the brain. I see those all the time, every day, a bunch of them. However, much more common, what we call small strokes, silent strokes. And I drew a skull and crossbones in here on the brain because these are the penetrating arteries. They go up around the cerebral convexities and they penetrate down deep into the brain. You don't have a lot of collateral reaching this spot. And what will happen is if a person is dropping their pressure or they just have a lot of atherosclerosis, they won't get enough blood to these areas. And I'll see tons of strokes in this area. One single patient can have 100 little small strokes. And these are things that will cause senior moments, slowing down, just can't find that word. And so you want to take good care of yourself because these things add up and they can become irreversible. I'll show you some pictures of them. Oh, by the way, this is a book I wrote about, Poor Man's Guide to Prevent Dementia, about a year and a half ago. And then I rewrote a new version and I added a whole bunch of stuff to it, Food, Mood, and IQ. It's the most advanced book ever written about what causes dementia. There's nothing even close to it. I go into all the common theories, the advanced theories, all the neurophysiology, all the things you can do to avoid becoming demented. Now let's look at an individual blood vessel. Here's an individual capillary in the brain. So normally these are the red blood cells. They're passing into the capillary, traveling to the other end. these little blue circles are the oxygen passing from the red blood cell to the neuron, the brain cell, the axon of the brain cell. Here's the cell body of the neuron. They have to go across this yellow thing here. This is the basement membrane. The spindle-shaped cells here are the endothelial cells, the lining cells of the capillary. Then there's the basement membrane. Then there's the smooth muscle cells. And the oxygen has to travel through all of that, reach the cell, and then help the cell to make energy, to make ATP. That's the energy currency of the cell, adenosine triphosphate. All right, now here are some red blood cells through a diseased capillary. This patient has diabetes, which leads to thickening of the basement membrane. See how the yellow stuff is thicker here than here? That makes it harder for the oxygen to get up to the neuron. The smooth muscle is hypertrophied as well. That makes it harder for the oxygen to get there. So what I'm saying is people who have hypertension and diabetes for years, not such a big deal, but for decades, which many people do, this wall gets thicker and thicker, and it gets harder to deliver oxygen to these cells. So this neuron can start becoming mildly deprived of oxygen delivery, and glucose also has to be delivered in similar fashion. Here's a good-looking, healthy, middle-aged brain. There's a little bit of atrophy, meaning a little bit of this dark stuff is the fluid pulling away from this white stuff. This is the skull, but this is still a relatively tight brain. When I say tight brain, what I mean is the brain tissue is uptight with the inner table of the skull. The ventricles are a reasonable size. So this would be a normal-looking middle-aged brain, let's say of a 60-year-old, all right? This would be a likely cognitively impaired or demented brain. The cerebrospinal fluid spaces between the brain tissue itself and the skull are rather large. So this brain is shrinking down. This is what I mean by a loose brain. This is tight, and that the brain tissue is up against the skull. Here, there's a big falling away of the brain tissue from the skull. This is the most common thing I see in dementia. I see an atrophic shrunken brain, sort of a shriveled brain. Here it is on MRI. The last thing was a CAT scan. This is MRI. On MRI, here's a normal-looking brain. This is what's called a flare sequence, which is really like a fluid-suppressed T2. You don't need to know all that, but what you need to know is these are normal-sized ventricles. Brain parenchyma is sort of tight up against the skull, which is sort of hypointense or dark, if you will, on this picture. So this is about as good as it gets for a brain, whereas this brain looks terrible, and I see tons of brains like this. And so what I mean is all these white spots, these bright spots, these are little strokes. We sometimes call them chronic ischemic changes, small vessel, atherosclerotic ischemic disease. These are the kind of things that I was referring to earlier when I was talking about Delatore's cerebral hypoperfusion theory with mouse equivalents. So not enough oxygen getting to the brain, and this is where those deep penetrating arteries would go, the corona radiata level. You get all these little strokes, and I'll see these all the time. But sometimes I'll see a brain where I don't even see any of these, but I see it atrophic and shrunken and fallen away. But you don't want this. That's a lousy looking brain for an 80-year-old. That's a lousy looking brain. You don't want that. That person right there, they might still know how to find their way home, but I wouldn't want them to balance my checkbook. Here's a patient with hypertension, and this is relatively severe hypertension. All these little black spots in here, this is what's called a susceptibility weighted image, meaning that it doesn't have a refocusing pulse. And that's just a fancy way of saying it's very sensitive to any metal in the brain. So iron is a type of metal. And at little bleed sites, you'll get little bits of iron from the previous bleeding, like the hemoglobin. And that will distort the magnetic field on the magnet of the MRI machine. And so you get all these black spots. And the central black spots in the basal ganglia regions, that is completely characteristic of hypertension. I see that every day. So central hypertension-related bleeds. But then in the periphery, you got a couple of these little spots in the periphery. That's nonspecific. That could be hypertension, but that could also be another disease called cerebral amyloid angiopathy. I actually think that a lot of it's due to hypertension. And I say that because I started double-checking these patients. And most of my patients with this stuff, they also have hypertensive retinopathy. It's the same patients. And I'll see young patients, they got a bunch of peripheral microbleeds. These are old microbleeds. So hypertension is a pretty bad thing. It's the number one risk factor for these silent strokes and for atherosclerosis in general, that and high cholesterol. I'll kind of go into that in a moment. One of the sort of more dramatic things you'll hear about is this is called an IPH, intraparenchymal hemorrhage in the basal ganglia region due to hypertension. These are rare. I only see one of these like once every 6 months. I see these every day. I see this once every 6 months. So these are due typically to severe hypertension, but they just don't happen very often. Whereas these things happen a lot, these microbleeds. And I know all that doom and gloom. I don't want to scare you. It's good to be a little scared so you're motivated to do good things, but I want you to know there's also good reason for hope and optimism. These are myelin. This is sort of like the insulation around an electrical wire. And the more you use a neuron, the more myelinated it gets. What that means is the more you do something, the more you maintain those neurons. So if you want to maintain the capacity to exercise, then keep exercising because you'll maintain the myelin around those neurons. Glycogen is energy storage, and this occurs in the glial cells, in particular the astrocytes, which they're shaped like a star, so they're called astrocytes. And they store glycogen when they can donate some to the neuron. The more you exercise, the more you use your brain for thinking, reading, studying, intellectual ways, the more glycogen you will store in those neurons. So the more you'll maintain your intellectual capacity. The more you exercise and use your brain, the more you'll maintain the blood vessels around the brain. So angiogenesis means the formation of new blood vessels. There's good and bad angiogenesis. The type of angiogenesis you get from exercise is good. The type of glycogen storage you get from exercise is good. You also, when you exercise, you get something called BDNF. Same thing when you study and you have intellectual conversations, brain-derived neurotropic factor. And that helps neurons to stay alive and to grow and to form new connections. To form a new connection is a synapse. That's synaptogenesis. You can form entirely new neurons. That's neurogenesis. So one of the things, for example, if a person has a stroke, they'll routinely only sort of try to rehab for a couple of weeks, 3 weeks, or at most 3 months. But I've seen people make fantastic recoveries, and they will rehab for 3 years, even for 7 or 8 years. There's a real famous lady. Her name is Jill Bolt Taylor. She has a nice TED Talk called My Stroke of Insight, and she wrote a book about it. She was an anatomist at Harvard, and she had a stroke, and she kept and she was hemiplegic, and she kept rehabbing herself for 8 years, and she made a full recovery. So not everybody's going to be able to make a full recovery after a stroke, of course not. But you keep pushing. She went and lived with her mother and just kept trying to do a little bit more each day. The fact that she had insight into what she needed to do helped, of course, but still, she did it. Here's microglia. These are the guard cells of the brain, the immune system cells, and you want them calmed down. So we'll talk about them later, but just so you know, they're there. And if they're calm, they'll just do their job and they'll help the neurons. But if they get excited, like they think there's an infection in your brain or some other problem, they sometimes overreact. So you don't want them riled up. If a person has a stroke, in the center of the stroke, there'll be dead brain, and that's called the infarct core. Surrounding the stroke, there'll be what is called penumbra. Penumbra is like one of these Greek words. It means twilight. And the penumbra cells could go either way. They might be restored to normal function, or they might progress on to death. And what I'm trying to tell you is everybody's had some previous minor traumatic brain injury. A lot of people have had little minor strokes. And what I'm saying is you want to take as good a care as you can of the rest of your brain. So whatever is in your penumbra phase will be restored to normal rather than progress on to becoming infarcted. So this is what I meant by there's a lot of things a person can do to try to improve brain function. And hopefully they've got enough motivation, enough insight, because some stroke patients are confused or they're not motivated, and then they don't try to rehab. But ideally, they should. And while you still got all your brain health, you should constantly have it in mind. I want to optimize my brain health. So just do the things that help the brain, avoid the things that hurt the brain. And by the way, atherosclerosis can be partially reversed. This is an atherosclerotic plaque. First of all, the thing you should know is an atherosclerotic plaque is a blood clot. They're the same thing. That's important to know, and hardly anybody knows that. I used to do imaging-guided surgery, a lot of work in blood vessels, putting in stents, doing thrombolysis, all those sorts of procedures. And I actually trained to be an endovascular brain surgeon, but it's a long story, but neurosurgery took that over, so I decided not to continue down that path. But the reason I tell you all that is I used to think those doctors, and I would hang around with cardiologists, with neurosurgeons, with vascular surgeons, cardiothoracic surgeons, and I thought, we are the doctors that really know atherosclerosis. But we're not. Those guys are just plumbers. Their job is to bypass a blockage. Okay, like a plumber would. The docs who really know atherosclerosis are the vascular pathologists, because they look at it under a microscope. And they look under a microscope like, hey, it looks like a blood clot. And I look at CAT scans, I look at CT angiograms. It looks exactly the same as a blood clot, because it is the same as a blood clot. Over time, it organizes, and what that means is parts of it are reabsorbed. You can also you can reabsorb and shrink down the lipid core, the fat in there, the necrotic core, the dead material, the acute clot phase. But gradually it's replaced by this F is for fibrous tissue, and it'll also become calcified. You're not going to resorb this. Some people are now saying you can resorb some of the calcium. I'll believe it when I see it. I haven't seen it yet, but maybe. I wouldn't hang my hopes on that. But what I am saying is this soft material can be reabsorbed. So very low-fat diets help to do that, as well as avoiding hypertension, avoiding sodium, for example, avoiding things that function like fat, excessive amounts of, let's say, alcohol, for example. Alcohol causes fatty liver, predisposes to diabetes, etc. High fructose corn syrup also. And that Caldwell-Esselstyn diet, low-fat, low-sodium vegan with no oil, it's proven to reverse coronary artery disease. It's got tons of patients that have shown that. So what I'm saying is, atherosclerosis is a systemic disease. You help reverse it everywhere in your body, and the cells come back to life, the endothelial cells, the lining cells of the artery, and they start making more nitric oxide to vasodilate, to prevent clotting, and that will improve oxygen delivery to your tissues. So you'd be better off. So there is good reason to be hopeful, and it's worth the effort to try to optimize things. We got something called a Windkessel effect, meaning that when your heart pumps blood, it stretches the ascending thoracic aorta, and that will then be distended outward. And then when the heart relaxes, there's elastic fibers in the ascending thoracic aorta. They will contract in. That's called elastic recoil. Windkessel is named after this thing. It means like the thing you use to blow air on a fire to sort of kindle the embers, to get them to light, to capture, to spark a big fire. The point of all this is when a person's hypertensive, chronically hypertensive, they keep overstretching those elastic fibers, and eventually the elastic fibers are lost. And then they no longer will be able to generate very good diastolic flow. So this is another reason why you want to get your act together as fast as you can. The sooner the better. Because if you chronically have a high blood pressure, you're going to overstretch your ascending thoracic aorta and you're going to lose the Windkessel effect. And that's bad because the left ventricle then has to pump harder. So it's going to become hypertrophic. It's going to get thickened walls. That's going to make it harder to perfuse the left ventricle. The left ventricle of the heart, it only gets blood flow in the muscle component, intramyocardial branches, when the muscle's relaxed. So if you're having to pump harder because you lost your Windkessel effect, that means your muscle's thicker and it's more often in the contracted phase, meaning it's harder to perfuse it. And you can see how you're headed towards a vicious cycle of needing more blood but not being able to get it because the muscle's thick and persistently contracted. Make sense? So you don't want to lose your Windkessel effect. And if you have lost it, there's things you can do. Eat low-fat, low-sodium diet. When you eat low-fat, your blood gets thinner. Low-sodium, you won't be vasoconstricted in your periphery, so you can pump the blood through under less pressure, and that makes life a lot easier for your left ventricle and for your coronary arteries. Normal blood flow is kind of laminar, meaning that it has a parabolic blood velocity profile. Red blood cells are in the center, as denoted by red. The blue stands for the white blood cells, the black for the plasma that runs along the side of the blood vessel. These are the endothelial cells that line the blood vessel. When you eat a high-fat meal, it's a bridging molecule, especially the LDL cholesterol. It sticks the red blood cells together. Uric acid can also do that. Fibrinogen can do that. Okay. When the red blood cells are stuck together, it's harder to pump them through the blood vessel. Typical capillary is about 5 microns in diameter. Typical red blood cells about 7 microns in diameter. So it's even bulkier when they're all stuck together with these bridging molecules. So you don't want that. This is just showing that on the outer surface of a red blood cell, you got a zeta potential, meaning a negative charge. And that's good. So they repel each other, so they don't stick together. You don't want them clotting. Examples of bridging molecules include IgM antibodies in the acute phase of an infection, for example. A bridging molecule is a positive charge and big enough in size that it can stick the red blood cells together. LDL cholesterol does that. That's why cholesterol is a risk factor for atherosclerosis, forming clots. Fibrinogen, the clotting protein. Uric acid can also do that. And you got a zeta potential around all your red cells, around all your white blood cells, and around your endothelial cells, the lining cells of your arteries. The higher the person's cholesterol, the higher their blood viscosity. Viscosity means thickness, like the thickness of the blood. And you don't want your blood to be thick because that means you got to pump at a higher pressure. Basically, your heart pumps blood to the top of your brain. If you're pumping normal blood relatively thin, it's easy to pump it to the top of your brain. If your blood's thick because of all the high-fat food in there sticking the red blood cells together, so then you're pumping a milkshake instead of pumping water up to your brain. So you have to pump at a higher pressure. And then if on top of it, you're eating real high dietary sodium, that constricts your blood vessels. So now your blood vessels are narrowed down. So now you're pumping a milkshake through narrow vessel. Pressure has to come up more. Not a good situation. When you eat high-fat meals, it makes your blood opaque. The plasma component, this is a blood draw spun down into a test tube. There was a good picture of this in the movie Game Changers about vegan athletes, how thick and opaque the plasma becomes when a person eats a high-fat meal. Dr. McDougall had a good video, 50 seconds long, at his YouTube channel about high-fat meal causing blood sludge. And you can see the red blood cells all sticking together. And that's why you feel a little sluggish if you eat a really greasy meal at a greasy spoon. Then what happened is Ansel Keys back in the 1950s showed that saturated fat, animal fat, was a major risk factor for coronary artery disease. And people thought in the 1960s, well, gee, PUFAs, polyunsaturated fatty acids, are going to be okay to eat. People should eat more of these oils, like corn oil and all the other oils. But this guy, Peter Quo, was a cardiologist in Pennsylvania, and he tested out that theory. And what he found was not a good idea. When, for example, you feed people sat fat, and he did this with a bunch of cardiac patients who had cardiac angina. He'll feed them a meal, for example, of sat fat, and he would check their blood lipids every 30 minutes. And what he found was when they were at peak lipemia, the highest amounts of fat in the blood, they would tend to get chest pain. It was kind of a crazy thing to do back in those days. There's no angioplasty or stenting, not great medicines to treat those patients. He's lucky they didn't die of heart attacks. But anyways, his similar experiments were repeated in the 1960s by two guys, ophthalmologists, Meyer Friedman and Ray Rosenman. And they did it with PUFAs, polyunsaturated fatty acids, like the omega-6 cooking oils. And they found that the blood stayed sludged an even more prolonged amount of time. The researchers would come in at 8 in the morning, and they would want to go home in the evening, and the patients would still have thick blood, and they were hesitant to let them go home. So what I'm trying to say is I'm not a fan of PUFAs. I think all fats are bad for blood flow. We're not going to get into all the detail of that, but I'm just telling you, they caused even more prolonged blood sludging, the PUFAs, than did the sat fat. Sat fat's got lots of problems. Sat fat is not good for you, but there's major problems with the PUFAs too. Whereas when you fed them no fat, they didn't get any of this lipemia, and they didn't have anginal effects, get chest pain. There were no angina episodes with the no fat meal. The red blood cells, the endothelial cells lining the arteries are spindle shaped along the direction of flow, and they've got hair-like projections that can sense the direction of flow. If there's an excessive amount of turbulent flow, as you get with severe hypertension at bifurcation points, they will then sense that as an injury to the vessel, and they'll shed their antithrombotic glycocalyx coating, and they'll start to express prothrombotic molecules on their cell surface. The only one you really need to know about is nitric oxide. I went to the Caldwell-Esselstyn course, a full-day course out in Cleveland, and he kept talking about nitric oxide. I was in the group, and I raised my hand. I go, well, what about this? What about this? And he goes, we'll talk about that later. And so afterwards, he came over and he talked to me, and he said, Pete, you just got to make sure the patient understands nitric oxide. If they understand nitric oxide, they will follow the diet, and they'll be successful. If you talk about a whole bunch of different things, you're going to confuse them, and then they won't follow the diet, and they won't be successful. So he says, that's why I don't ever go into that other stuff. And he's right. They just have to understand this is why you eat a low-fat, low-sodium vegan diet with no oil. And Esselstyn says no oil, not one drop. Nitric oxide is a gas. It diffuses into the arterial lumen, and it prevents the platelets from clotting. It diffuses into the wall of the artery, and it causes the smooth muscles to relax. The vessel will dilate. There's other features of these endothelial cells that prevent clotting. They're antithrombotic. Okay, here's the blood coming up through the common carotid artery in the neck, and it hits the dividing point, the median divider between the external carotid artery that goes to the face, and the internal carotid artery goes up to the brain. And if the pressure is too high, like very hypertensive, it'll bounce off and have an excessive amount of turbulent flow. That will also have some retrograde eddy current. And again, the endothelium will sense that as an arterial injury. It'll shed its antithrombotic glycocalyx. It'll express prothrombotic molecules, and you'll form a clot right there on the far side away from the median divider. And that's an atherosclerotic plaque. And then you end up in a steady state situation. Most of the time, it doesn't change that much for even years, but it can potentially grow and toss off parts up to the brain. It's called to embolize, to travel from one spot to another and cause a stroke. As the patients get older, it'll just tend to slowly get worse. So you really want to get all your health habits together to get these things to shrink. Also, they'll become calcified over time and irreversible. This is just a little more detail about everything these endothelial cells do. One thing to know about is when you eat greens, like with a salad, you chew the greens and you release what are called plant nitrates, NO3. And then the bacteria on the back of the tongue will convert those plant nitrates into nitrites. This should be nitrites. That's NO2. Then when they go into the stomach, they mix with the stomach acid. They're converted to NO, just a single oxygen, nitric oxide. So it's a nitrogen and an oxygen. And that travels through the body, causes systemic vasodilation. And Dr. Caldwell-Esselstyn recommends this a lot. I think Nathan Bryan is the guy who works with the PhD, who's also a big proponent of understanding this. And that's why they also recommend avoid things that damage the bacteria on the back of the tongue, things like mouthwashes and some toothpaste, because he said that'll make it harder for you to get the nitric oxide effect systemic vasodilation from eating your greens. Also, when you go out in the sun, you get a release of nitrate to nitric oxide precursors, and they're released throughout your body. And that's why you feel good when you walk out in the sun. You get this systemic vasodilation effect. That feels good. Yeah, using mouthwashes that kill those bacteria in the back of the tongue can increase your blood pressure. Hematocrit is how high the percentage of red blood cells are in your blood, like the amount of RBCs here in your blood if you take it into a test tube and sediment it out, centrifuge it out. Over 99% of the blood cells in your blood are red blood cells. One of the reasons why women live longer than men is because they menstruate. When they menstruate, they lower their hematocrit. And because their hematocrit is lower, their blood viscosity is lower, meaning their blood is thinner. It's easier to pump it everywhere. So they have less hypertension, so they get less atherosclerosis, and they live longer. Women who get a hysterectomy at a young age, let's say below 35 years of age, they stop menstruating. Their blood becomes thicker like a man. And most of the time, women are not as aware of it. Guys start becoming more aware of atherosclerosis usually at a younger age because they've seen more of their friends suffer from it. They know guys who've become impotent. They know guys who've had heart attacks. And so because of that, they're a little scared. They start worrying about their blood pressure and all this stuff and their cholesterol level. But anyways, I've seen lots of demented women with severe hypertension. And the Mayo Clinic did a study on them, over 2,000 hysterectomies. And the patients who had it at a young age before age 35, most of the time for fibroids, they had a markedly increased incidence of coronary artery disease, hypertension, strokes, and early onset cognitive impairment, congestive heart failure. So people aren't as aware of that as they should be, that getting a hysterectomy at a young age is actually a big deal, and it's detrimental to health in that sense. Here's a plasma membrane of a typical cell, a neuron cell in your brain. And the important thing to know is it functions like an electrical battery. You're taking in 2 positive charges, pumping out 3 of them, and that creates a gradient, an electrical gradient, negative 65 millivolts across this plasma membrane. It's also a chemical gradient because you're pumping a lot of sodium out of the cell. And so you're going to have a chemical gradient as well where sodium wants to come into the cell. And that desire of sodium to come into the cell, both to normalize its chemical gradient and because of the electrical gradient, it's positively charged, sodium is Na+, and you got a negative 65 millivolts inside the cell. That can be coupled to doing other things like pumping out calcium. And the cell really needs to pump out calcium. This ATP pump that's used to do the initial part of the ion control pumping, it uses an ATP, adenosine triphosphate, gives off a phosphate, it's converted to adenosine diphosphate, ADP. Also, you need magnesium as a cofactor for this. So the point I'm saying here is you need to eat decent amounts of potassium and magnesium in order to run these pumps at optimal effectiveness. About half to 2/3 of the energy in a brain cell goes to run this pump. It is the most important electrical system in your brain cells. So our ancestors all ate a lot more potassium than sodium. It's only in the modern crazy world do people eat more sodium than potassium. That's going to end up being a big deal. CAPE stands for kalium, which is the Latin word for potassium. Na stands for natrium, which is the Latin word for sodium. And the NACA is the sodium calcium exchanger. And that's like one of the most important ways to get calcium out of the cytoplasm. So you want this pump running well. And it is coupled to the energy generated by this potassium sodium pump. So that's why eating plant foods, which gives you lots of potassium and lots of magnesium, optimizes function of this pump. Versus if you're eating processed foods and a lot of times meat is flavored with sodium or preserved with sodium, you're going to get high amounts of sodium, low amounts of potassium. And that's not good for these pumps. What I meant about magnesium being needed for the ATP reactions is you got a powerful negative charge on these phosphates and they want to break away from each other. And the magnesium has a positive charge which sort of holds the negative charges of the phosphates together until the correct time in the reaction to release the phosphate. So magnesium is real important. You can remember M for magnesium, M for mellows you out. Magnesium is located right in the center of chlorophyll. So you eat your plant foods, you'll get your magnesium. Here's another look at a brain cell, a little more detail here. And here's the important points. Normally, calcium outside the cell is about 10,000 to 15,000 times higher than the concentration of calcium inside the cell. When calcium levels in the cell increase, the cell is activated and it'll release its neurotransmitter, for example, glutamate, and it'll then cause travel to the other side and affect the adjacent neuron. But the point I want to make is when you want to turn that neuron off, you got to get that calcium out fast. You get it out with a NACA exchanger. There's 2 other options you could do. But remember, the electrical battery power comes from this potassium sodium pump over here that depends on ATP made by mitochondria, and it depends on magnesium being present and plenty of sodium. Usually you don't need to worry about sodium. Most people have way more sodium than they need, but very commonly people are deficient in potassium and magnesium because they don't eat enough plants. Here's just a little more detail. The glutamate neurotransmitter vesicles travel to the synaptic cleft. Glutamate diffuses across the cleft, activates the receptors on the postsynaptic neuron to cause it to be activated. If you overactivate this neuron, you can cause bad things to happen, like you can activate calpain, a harmful protease, but normally that should never happen. Also, magnesium, and a magnesium ion sits in the center of this receptor here for glutamate. It's called the NMDA receptor, and not until there's a preliminary depolarization of the cell because of the AMPA receptor for glutamate does this magnesium bounce out of the way. But what's the point of this? The point is you need magnesium also, besides stabilizing your ATP molecules, you need magnesium to block your NMDA receptor. We often call it DAR. And because if you're low in magnesium, this receptor is going to let calcium through much more easily. You don't want to overstimulate your neurons for nothing. That can make you anxious. That can cause insomnia. It can also cause a paradoxical depression. It's bad. You don't want that. There's a good reason why people who eat plant-based diets are happier. They tend to be more calm. They tend to be less impulsive. You can see that on the internet. Just go around looking at some of these paleo, keto, carnivore sites, how they behave, and then they go to plant-based vegan sites and they write a lot of impulsive, sort of poorly behaved comments. You'll see that. So their behavior matches their diet, my understanding of neurophysiology. So anyways, when you want to turn off the cell, you want to lower your calcium concentration in your cytoplasm, and you're going to pump it out with your knockout exchanger. You can pump it into your endoplasmic reticulum. The pumps are called Circa pumps. That's a fancy way of saying the S really comes from muscle cells. They have something called the sarcoplasm. So it means sarcoplasm, endoplasmic reticulum, calcium ATPase. It's a big fancy word. Just remember Circa. And all it means is you're pumping calcium into a storage site, into this organelle called the endoplasmic reticulum to get it out of the cytoplasm. You have to get it out of the cytoplasm, otherwise it'll keep causing the release of neurotransmitter. You don't want that. You only want it to release neurotransmitter when it needs to. There's another pump over here, the plasma membrane calcium ATPase, but it's a slower pump. It's not that important. The knockout exchanger is really important. Circa is really important. Another thing here is what is called the K factor. This comes from a book by a guy by the name of Richard Moore, MD, PhD, devoted his whole life to researching membrane ion pumps. And his conclusion after studying it for like 50 years was that people really need to eat more plant foods to get more potassium, and they really need to eat at least about 5 times more potassium than sodium to prevent hypertension. I'd actually say it's probably good to keep it at least around 10 to 1. And he calls that the K factor, the ratio of potassium to sodium in the diet. All you got to do is look at a food, and you will see that plant foods routinely have far more potassium than sodium, versus processed foods will often have equivalent amounts or more sodium than potassium. I'll even look at a food if I think it's pretending to be a good food, but it's not, and I'll notice that those relatively high amounts of sodium is a typical finding. So there's lots of things that will increase cytoplasm calcium, including EMF, including traumatic brain injury, including a lot of medications, including MSG. You don't want that. Being stressed out, sleep deprived, caffeine. You don't want to be overactivating these neurons. So the point I'm showing you this slide is a lot of things will activate it. You'll also get activation of it through things like having leaky gut, not eating enough dietary fiber. If you're using your cell phone, talk to your speakerphone. Don't hold it to the side of your head. All of these things add up. And one of the things I don't like about processed food is they often contain mitochondrial inhibitors. Here's a mitochondria. A mitochondria is the energy production factory within a cell. And this is where ATP is made. There's basically an outer mitochondrial membrane. There's an inner mitochondrial membrane, the green one here, IMM. There's an intramembranous space, IMS. That's where the protons are going to be pumped into this intramembranous space. Inside the center of the mitochondria, that is the mitochondrial matrix. And to make energy from glucose without using oxygen is called fermentation or glycolysis. Once you use the proton pumps of the mitochondria system, that's called respiration. The mitochondria is brilliant. It's like genius. It splits the atom. It splits the hydrogen into its atom, into its protons that are pumped into the intramembranous space, and to its electrons, which are passed down through these carrier proteins. And it's going to use this gradient of hydrogens, really a pH gradient, to harvest it and make ATP. This last protein complex is called ATP synthase. So here's just another picture of the same thing. Outer mitochondrial membrane, OMM, inner mitochondrial membrane, IMM, and the proton pumping complexes 1, 3, and 4. So electrons are passed from complex to complex, kind of like traveling down a wire, an electrical current, and the energy of that current passing, kind of like the energy of a mill wheel or of a snowball rolling down a hill, is used to pump protons into the space and build up a proton gradient. And again, you harvest the gradient by letting it come through this final protein complex called ATP synthase, and the energy of spinning that complex gets the phosphate to be connected to ADP to make it into ATP for energy. We're going to talk about how you can get problems, especially at complex 3, as far as our purposes are concerned. By the way, the proton gradient across this inner mitochondrial membrane, it's incredible. It's like 160 millivolts. It's huge. And the relevance of that is that's the highest gradient in the human body. It's like having a lightning bolt. It's like an electrical processing plant. It's really powerful. And the mitochondria, they run hotter than the rest of the cell does. But if we run into problems here and we can't get these electrons transmitted rapidly and we can't pump these protons rapidly enough, this complex can start going backwards and we can start dropping electrons off a coenzyme Q down into the matrix and having them combine with oxygen. And when they combine with oxygen, a single electron, it'll form a superoxide, which is bad. That's a free radical. It has an unpaired electron in its outer orbital. And this can cause oxidative stress. It's also called an ROS, reactive oxygen species. Normally, it will be neutralized by an enzyme in the mitochondrial matrix called SOD for superoxide dismutase. But I'm going to explain the point of this. So fat will do this, especially saturated fat will cause problems at the level of complex 3 and a backup of electron transport. That causes insulin resistance. That causes diabetes. I knew there had to be other causes of it, and I was very interested in biochemistry. I almost became a biochemist. I was like about the best biochemistry student in the whole United States when I was in medical school. And I figured I'll look up my biochemistry books. I own about 7 biochemistry books. And I went through all of them. I couldn't find anything about mitochondrial inhibitors, but I knew they had to be there because I'd come across them in different papers I had read. So I started searching for mitochondrial inhibitors, and I very quickly found over 60 of them. Over 60 of them. And many of them are quite common. You've heard of lead. You've heard of fluoride. You've heard of PFOA for nonstick cookware. You've heard of hydroxynonenal from omega-6 cooking oils, lipid peroxidation, toxic aldehyde byproduct. You've heard of TCE, trichloroethylene, for cleaning chemicals in dry cleaner places. That's why I don't go to dry cleaner anymore. They increase your risk of Parkinson's disease. I would never work in one of those places. Liquid paper, anything that transitions rapidly from liquid to solid can be harmful. It can give off volatile organic chemicals, some of which are mitochondrial inhibitors. In all the processed foods, they put antifungals. Those are mold inhibitors. Those routinely are mitochondrial inhibitors. A lot of common drugs, Tylenol, I wouldn't take Tylenol. Statins inhibit coenzyme Q. I wouldn't take a statin. I know they're popular drugs, but I wouldn't take them. That's why they increase the risk of diabetes. What else? Metformin, a common diabetes treatment drug. I wouldn't take it. A lot of people think, oh, isn't it great? Some people think it should increase longevity. I wouldn't take it. Glyphosate, what they spray, non-organic soy. I wouldn't take it. I don't ever eat that stuff. Atrazine's a complex 3 inhibitor. That's what they spray. Complex 3 inhibitor, atrazine. That's what they spray on non-organic corn. I wouldn't eat that stuff. I'm just like a lot of antibiotics will do it as well. Aminoglycosides, fluoroquinolones. I wouldn't take fluoroquinolones unless I was at death's door. I wouldn't take those drugs. Beta-lactam, or penicillins, a lot of stuff, a lot of these heavy metals, excessive amounts of iron. We'll talk about how you can become iron overloaded commonly. Al, aluminum can do it. Excessive copper. Some of these anti-seizure drugs can do it. They slow down the brain. They also slow down mitochondria, like valproic acid. Other things can inhibit mitochondria at a different level than the electron transport chain. Alcohol does it. Alcohol is bad. It's toxic in the brain. I recommend 0 alcohol, not 1 drop. Arsenic's not as common, but we'll talk about arsenic some other time. Traumatic brain injury. All right, so anyways, there's a lot of mitochondrial inhibitors, and there's a whole bunch I didn't even get to yet. There's more cadmium in non-organic food come from the phosphate fertilizers. There's a lot of them. Serotonin selective reuptake inhibitors, antidepressant medications. I wouldn't take those things. Okay, what is insulin resistance? So normally insulin binds to a cell, binds an insulin receptor through a series of intermediate receptors. It causes the glucose type 4 transporters to travel from the cytoplasm up to the plasma membrane, merge with the plasma membrane, and form channels to allow glucose into the cell. After you eat a meal, a huge percentage of your glucose from your meal should go into your skeletal muscle. Eating a meal is prandial, so postprandial. Postprandial, most glucose should go into the skeletal muscle for storage as glycogen. A lot gets stored in the liver as well, and it also travels all over the body. Excessive dietary fat, like I said, causes a problem at the level of complex 3. It starts going backwards. You start dropping electrons down to oxygen, creating superoxides. If you make too many of them, superoxide dismutase gets overwhelmed, and then this superoxide will start to damage DNA. Through a series of steps, it'll be transmitted to the nucleus, and that will cause insulin resistance, and it'll activate a bunch of side pathways. I think I maybe have the paper in here. So what happens if you have excessive dietary fat, your mitochondria will send what's called an overnutrition signal to the cytoplasm to block these glucose type 4 transporters from going up to the plasma membrane of the skeletal muscle cell. So then the glucose can't get into the cell after eating. So this will cause postprandial hyperglycemia, meaning that your blood sugar will go up after eating. So you don't want to eat excessive amounts of fat, especially not excessive amounts of saturated fat. This is a ectopic fat theory, and I sort of designed some of these slides myself, but it also comes primarily from the work of Gerald Shulman. He won the Banting Award in 2018, and with nuclear magnetic resonance spectroscopy, they showed the first finding of insulin resistance is intramyocellular lipid. That means fat inside your skeletal muscle cells, and that will cause postprandial hyperglycemia, after eating high blood sugar. Eventually, you'll get more fat accumulating in the liver, and then you'll have fasting high blood sugar, fasting hyperglycemia. And then there's some cells in the body that cannot adequately regulate their glucose intake. They just take up whatever's in the blood. That's called constitutive take-up. And that's how you get diabetic retinopathy, diabetic nephropathy, damage to the kidney, damage to the eyeball, diabetic microvasculopathy, and you lose your feet to amputation because you don't got blood flow down there. So it's not good. And they often are cognitively impaired. A little more information is that when you get excessive opening of these glutamate channels, they can start activating side pathways. There's nitric oxide in the blood vessels that Caldwell Esselstyn talks about all the time. That comes from eNOS, endothelial nitric oxide. But there is something called neuronal nitric oxide synthesis, and you don't want that overactivated because that'll produce too much nitric oxide. It'll go into the mitochondria, combine with superoxides, and produce peroxynitrites. Those are bad. So the key point I want to make is nitric oxide in brain cells is different than it is in arteries. In arteries, it's good. In brain cells, small amounts are good, but big amounts are bad. These are the microglial cells, the guard cells, the immune system cells in the brain. And again, you want them calmed down. If they become activated by sleep deprivation, excessive caffeine, excessive stress, they sort of become more predisposed to overreact to minor problems, and that can cause collateral damage to brain cells. And you don't want to be smoking cigarettes, very stupid thing to do. You don't want to be inhaling toxic fumes like from paint or from diesel exhaust or other sources of volatile organic chemicals, because that can activate your microglia and cause brain damage. The microglia, they're part of the immune system, so they got PRRs, those are pattern recognition receptors, and they also will react to LPS, that's bacterial endotoxin. LPS stands for lipopolysaccharide, comes from gram-negative bacteria. LTA stands for lipoteicholic acid, comes from gram-positive bacteria, and so you don't want these things getting to your brain. When you have leaky gut, you'll often have leaky brain, and these will contact your brain tissue, and they can activate microglia. You don't want that. I'm not going to go into all the details of nitric oxide metabolism, but the one thing I would say is when you activate your microglia, they have a different type of nitric oxide synthase. So eNOS is for endothelium in your arteries. That's the good stuff, like Dr. Esselstyn talks about. nNOS is the stuff in your neurons, neuronal nitric oxide synthase, and that's usually good, but if it's overactivated, it could be bad. But this is the one that's bad. The inducible nitric oxide synthase on your microglia cells, the guard cells of your brain. You don't want those cells unnecessarily activated because, especially like if they get activated by LPS, bacterial endotoxin, they think that the brain's being invaded by a bacterial infection, bacterial meningitis, and they'll start releasing these toxic chemicals like excessive amounts of nitric oxide. Normally when eNOS or nNOS is activated, it's very brief. It's like for a microsecond. It's a nanomolar amount, but for very brief amounts of time. Versus this will stay active for hours, and you're going to release tons of nitric oxide, and you're going to produce peroxynitrites, and those will cause damage. Because it's basically trying to sterilize the area around it, and the neurons that are in that vicinity will be caught up in the collateral damage, and they can be destroyed. You don't want that. Peroxynitrite, when it's present in large amounts inside a cell, it'll damage mitochondria. It's the purple thing here, purple people eater. It'll damage the plasma membrane calcium ATPase. It'll damage the circuit pumps. It'll even damage the NMDA receptors. It's bad. It'll quite often kills the brain cell. You don't want peroxynitrites. One thing about exercise, we kind of talked a little bit about this with the Voltaire quote, but I'll just mention the sea squirt. The sea squirt's this animal in its juvenile phase. It swims around like a tadpole. In its adult phase, it attaches to a rock, becomes a filter feeder, and it reabsorbs its brain. The point of the matter is if you don't move, you don't need a brain. So you've got to keep moving. Whatever form it is, you got to do some type of movement, okay? Because you keep all your brain cells being active, and you keep your thinking cells also relate to your movement. So you don't want to be a couch potato sitting around just watching TV all day. That makes you stupid. And one of the best things you could do is get moving to maintain your brain and to age better. Like I'll come home from work and I'll walk around in a circle sometimes reading a book. I also know, like if I'm spacing out on reading a book, I get up and I start walking. I'll often be able to concentrate better, because when does an animal need to be alert? When it's moving. You're walking through the jungle, you got to pay attention to where you're going and what you're doing. You become more alert. So getting up and walking can help reading a book. All right, now here's how the gut works. These little smiley face bacteria in the gut, they like to eat fiber. And they eat the fiber and they make short chain fatty acid. The most important one is butyrate. It's 4-carbon short chain fatty acid. That is taken up by the gut lining cells. They're called enterocytes because site means cell, entero means gut. The gut is called the enteric tract. So these enterocytes use the butyrate to make tight junctions. So they want these cells tightly connected to each other. That prevents bad things from getting across your gut barrier. It's only a single cell thick. And if you have leaky gut, meaning that you don't have tight junctions, you can get bacterial endotoxin, LPS, lipopolysaccharide, getting across the gut barrier. You don't want that. It gets into your blood, can cause problems. After eating is postprandial. It's in the blood, so it's anemia, postprandial endotoxemia, and that'll cause problems. It'll cause inflammation. It'll cause clotting potentially. These are a whole bunch of things that can cause leaky gut. Things like excessive amounts of saturated fat, excessive amounts of vegetable oils, emulsifiers in processed food, alcohol, some antibiotics, some of these herbicides on non-organic food like GP we talked about earlier. All of those things can potentially damage your gut lining and cause leaky gut. So you don't want that. You want to make sure you're eating decent amounts of fiber and try to avoid processed foods and these other chemicals. These also predispose to autoimmune disease. I'm not going to get into it, but they predispose to something called molecular mimicry with autoantibody cross-reactivity. Animal foods cause this a lot more. With plant foods, you help protect the gut lining. There's no fiber in animal foods. There's always fiber in plant foods. By the way, that butyrate doesn't just protect the gut barrier. It also protects the blood-brain barrier. And you want the blood-brain barrier protected so you don't get harmful chemicals into your brain tissue. So here's another paper on how the fiber protects the blood-brain barrier. The fiber helps maintain synaptic plasticity. It turns off microglia to decrease brain inflammation. It does all kinds of good things. So fiber is your friend. It's not just a friend to your gut. It protects your brain, your blood-brain barrier. It protects your kidneys, your glomerulus barrier, your blood-kidney barrier. It also protects your eyeballs, your retina blood barrier. It protects your gonads, like your testicle blood barrier. It protects you. You want to get your daily fiber. It's important. Average Americans only eat like 5 to 10 grams a day. Our ancestors probably ate about 100 or more grams per day. At a minimum, you should try to aim for getting about 50 grams a day, okay? And to do that, you're going to have to eat plant foods. That's the smart thing to do. I eat plant foods because I want to be healthy. So here's what happens if you got leaky gut. You start getting some of these bacterial endotoxins, gram-negative bacteria, LPS getting into the blood, gram-positive bacteria, LTA getting into the blood. If you eat iron-overloaded foods, like a lot of refined foods are so-called fortified with iron, that's all bad. They're going to cause something called amyloid clotting. You've got a blood clotting protein in your blood called fibrinogen, and normally it's shaped like a slinky, like a cylinder. When there's these chemicals in your blood, they will change the shape, and it'll flatten out and it'll stack up like a deck of cards. That's called a beta pleated sheet configuration. This is what is called secondary protein structure. And to change secondary protein structure is called an amyloid transformation. So you go from being cylindrical to being flat. It's hard to stack a bunch of cylinders. You can't stack a bunch of soda pop cans that easily side to side, but you can stack a deck of playing cards very easily. And this will form very refractory clots. These refractory clots are hard to dissolve. It's called amyloid clots. The researchers who figured out a lot of this stuff were Douglas Kelleth from England and Etheresia Pretorius from South Africa. And amyloid clotting It's bad. It's harder to dissolve these, and they increase your risk of plugging up small arteries and causing brain damage or heart damage. They've also shown that iron has a similar effect. Iron causes something called ferrous redox cycling in the blood if you get excessive amounts of it. The way to think of iron is like a fire. And this was said by a guy named Ed Weinberg. He's a scientist who studied iron. And he said, you want iron in your fireplace to warm your hands, or in your furnace to heat your house. You want iron on your stove, like fire, to cook your food. But you don't want fire anywhere else in your house, because it burns things down, it damages them. It's the same thing with iron. Once it starts ferrous redox cycling, it's a transitional metal with a variable valence between Fe2 plus Fe3 plus, Fe2 plus Fe3 plus. It starts handing off electrons to surrounding oxygens and other chemicals, and that can cause oxidative stress, damage your fibrinogens, and pop them into amyloid configuration, where they start forming unnecessary clots sort of randomly. So here's their names. Etheresia praetorius, the lady from South Africa; Douglas Kell, the guy from England. And they've shown it. It's a big deal. They're some of the most cited scientists you'll read. They've done a lot of great research. Men start becoming iron overloaded in their 20s from eating a lot of meat and eating processed foods that are fortified with iron added to it. Women don't tend to have a problem with this until they're postmenopausal. But when you get excessive amounts of it beyond the body's storage capacity, then you start increasing the amount of oxidative stress, meaning you get all these reactions. Oxidative stress just means you have more oxidants than you have antioxidants. Antioxidants come from plants, so you want to eat your plant foods to help prevent that, and you don't want to be iron overloaded. I like to keep my serum ferritin. I try to aim for between being about 30 to 80. Some people donate blood to lower their serum ferritin. Hemochromatosis patients have to do that. Mine was about 270 because when I was a kid, I used to eat too much of this iron-fortified Raisin Bran cereal. I didn't know it was iron. I didn't understand the significance of it when I was young. But by pulling off a couple extra tubes of blood every time I go for blood labs, I got mine down to about 110, which is pretty reasonable. The blood laboratories will tell you normal's 30 to 400 or something, but actually, ideally, you want to be about 30 to 80. From my reading of the literature, that's the best. This is what I meant by ferrous redox cycling. It starts going back and forth from Fe2 plus Fe3 plus, Fe2 plus Fe3 plus, 2 plus Fe3 plus, and it can activate what's called the Fenton reaction. Will give electron to hydrogen peroxide and produce hydroxyl radicals, and those can damage a lot of tissue. Like I said, antioxidants come from plants. Imagine you're outside, it's 100 degrees outside, the sun is bearing down upon you. If you as an animal, what are you going to do? You're going to walk on a tree and get some shade. But a plant can't do that. A plant has to fight and protect itself with just chemicals. So it produces antioxidants to protect itself from the excessive stress of the sun. When you eat large amounts of fat, especially sat fat, it activates your neutrophils. Your neutrophils will produce something called MPO, myeloperoxidase. And that myeloperoxidase will then, it's very cationic, meaning very positively charged. It'll interact with your endothelial, e.g. is endothelial glycocalyx. Those are the proteins on the outer surface of red blood cells and endothelial cells that line your arteries. And they're negatively charged. That's what's called, they have a zeta potential. And it'll bind with that zeta potential and collapse down the glycocalyx, the antithrombotic glycocalyx. And now the white blood cells, the neutrophils, can bind to these adhesive molecules like VCAM, vascular cell adhesion molecule, and the other ones. Anyways, this will increase the tendency to form clots. This will increase the tendency to enable white blood cells to pass into the subendothelial space. It's bad. It increases your risk of forming clots. So what I'm trying to say is eating high-fat meals increases a lot of problems. It predisposes you to increased neutrophil activation. It's damaging to your glycocalyx. It causes blood sludge and hypertension, which can also damage your arteries. This just shows more of the same thing. Glycocalyx collapses down, neutrophils start to bind to the adhesive molecules, and you can start forming clots like I showed you on that internal carotid artery picture earlier. What else can happen? When you get leaky gut, you'll tend to get leaky blood-brain barrier because quite often it's a deficiency of butyrate, and it can be some other damaging chemical in the blood that leads to inability of those good bacteria to produce butyrate. And so you'll also have leaky blood-brain barrier. So if you get the bacterial endotoxin across the gut wall, the LPS, the LTA, they can also get increased access to the brain potentially. And then once the microglia guard cells of the brain find them, they go LPS, incoming LTA, alert, sound the alarm, possible bacterial meningitis. We got to neutralize this quickly. Then they'll release a bunch of toxic chemicals like tons and tons of inducible nitric oxide. And that's going to combine with superoxides in the vicinity and produce peroxynitrites, just damage and destruction. And you're going to destroy some of your neurons in that location. And if you've got important memories on those neurons, you're going to be more vulnerable to losing them. There's another thing happening in the brain cells. They've got a way to make sure everything's okay. Normally, your brain cells are producing extra ATP to run these plasma membrane flippase and floppase enzymes. So flippase and floppase, great names for these, they keep your plasma membrane phospholipids in a certain configuration. They want to keep phosphatidylserine, and ethanolamine on the inner side. That's normal. That's good. They want to keep phosphatidylcholine on the outer side. But if the cell's not making enough ATP, it's too low in its energy, it will not be able to maintain this differential distribution of phospholipids. And there's complement proteins that will sense that. And when you have too abnormal of a distribution of your phospholipids, that's an eat me signal. You get externalization of phosphatidylserine, these red ones, to the outer leaflet of the plasma membrane of your neuron. And then these microglial damaged neuron must remove, and they'll take it and remove it away. So processes which deplete the energy production capacity of a neuron, like hypoxia, lack of oxygen, hypoglycemia, low blood glucose level, hypoperfusion for all the reasons we talked about, not enough blood pumped to the brain. Mitochondrial inhibitors can worsen this process, SERCA inhibitors for that calcium pump to the endoplasmic reticulum. All of these things can damage your brain cells, and then once they can't make enough energy, microglia just eat them, remove them. So you don't want that. Now I'm going to talk briefly about Tetsumori Yamashima. He's a brilliant Japanese neuroscientist, MD, PhD. And what he figured as the main reason why so many more Japanese people are becoming cognitively impaired and demented was because they're eating too much fried food. And that leads to a series of lipid peroxidation reactions, and they produce something called a toxic aldehyde called hydroxynonenal, HNE. And that's going to bind with a heat shock protein number 70. I'll show you a better picture of it in just a moment. This is a picture from his paper, though. And once you damage your heat shock proteins, you initiate a cascade of events that will often cause neurons to die. So here's a PUFA, polyunsaturated fatty acid. Saturated fat has no double bonds. A MUFA, monounsaturated fat, the most important fat in olive oil, has only one double bond. A PUFA, polyunsaturated fat, has more than two double bonds. The carbon in between the double bonds is called the methylene bridge carbon, and it has only a loose grip on its hydrogen. That hydrogen can easily be plucked off. When it's plucked off, you can undergo a lipid peroxidation reaction. Anyways, this can lead to the formation of hydroxynonenal, HNE. HNE inhibits the mitochondria, inhibits ATP synthase. So that's one reason why it can cause brain damage. It causes some other problems, lipid peroxidation reactions, but you don't want to be eating these omega-6 cooking oils. So this is a lipid oxidation reaction, whereas the hydrogen is plucked off, and then you add an oxygen to it. Two oxygens in a row on an organic molecule is called a peroxide, and this can cause a chain reaction that damages other tissues. So the big thing that it does, though, is the HNE, the toxic aldehyde I mentioned earlier, will bind to the heat shock protein number 70. Heat shock protein number 70 normally has an important job. It is like a chaperone, and it helps deliver dysfunctional proteins to the lysosome so they can be recycled. It also maintains the lysosomal membranes. There's powerful digestive enzymes in the lysosomes like cathepsin. So what happens when hydroxynonenal comes into the brain cells, binds heat shock protein, and that makes heat shock protein very attractive to calpain, the protease. It makes it taste good. And calpain will then cut the heat shock protein in half, and it no longer can do its job, chaperoning proteins and maintaining the lysosomes. And then the lysosome will break apart, its digestive enzymes will spill into the cell, and they'll kill it. So you don't want that. So eating omega-6 cooking oils kills brain cells. You don't want that. Another thing not a lot of people know, everybody's heard of estrogenic chemicals, but it turns out a lot of estrogenic chemicals are also neurologically toxic. About 20% of them are toxic to the thyroid and contribute to causing hypothyroidism, but about 80% of them have a component of neurotoxicity. Like I mentioned, BPA and atrazine, they're both inhibitors of mitochondrial function. This guy, Gilles Seralini, he's the one who wrote this paper, and he went through all of them, and you'd be surprised how bad they are. So I try to avoid all of them as best I can. And now I'm going to show you my theory. This is a Peter Rogers, MD, theory of neurodegeneration. And what it is a supply and demand theory. So normally you got a baseline metabolic rate in your neuron, and you have a baseline oxygen and glucose delivery. They have to be coupled to each other. Supply and demand have to be matched. So if you increase the metabolic rate of your neuron because you're sleep deprived, you're stressed out, you're emotional, and let's say you're drinking caffeine, all those things raise up the metabolic rate of that neuron. So you should have a compensatory supply and demand matching increase in your oxygen and glucose delivery of that blood vessel. Well, if you're eating a high-fat meal, usually that's going to drop your oxygen delivery about 15%. If you're also caffeine, not only does it increase metabolic rate, same thing with being stressed out and being sleep deprived, it also drops your oxygen and glucose delivery. It vasoconstricts to the frontal lobes. And so you're going to get a little bit of a gap between the metabolic rate of the neuron and the oxygen and glucose delivery. Right? You don't want that. Other stimulants can be tobacco, amphetamines, attention deficit medications, other things that activate the glutamate receptors, like the glyphosate will do that, the beta amyloid protein will do that, aspartame will do that. You don't want that. And if that's coupled to other problems, like we talked about, all the dilatory stuff, congestive heart failure, atrial fibrillation, aortic regurgitation, aortic stenosis, you're all going to cause wider and wider gaps between the metabolic rate of the neuron and the oxygen glucose delivery, the ability to produce energy. If that gap gets too wide, the neuron dies. It goes into apoptosis, programmed cell death. And there's other things that will contribute to this. I showed you all those mitochondrial inhibitors. Well, you need mitochondria. That's where most of the ATP in your cell is made, over 80% of it. If you can't make that ATP as effectively as you should, that means that you're going to have, it's the same thing as dropping oxygen and glucose delivery, decrease energy production capacity. Well, if you can't pump that calcium out of your cytoplasm, and it's always ATP dependent, you need that ATP energy because you're always pumping against a gradient, you're going to start widening this gap between metabolic rate and energy production capacity to pump those neurons out. And so if you don't have adequate supply to meet your demand, those neurons just die. They go into apoptosis, programmed cell death. They get the calcium accumulation in the cytoplasm, where that calcium cytoplasm concentration goes up and up, and the cell just becomes overactive, can't meet its metabolic demands, and it activates the apoptosis pathway. So you want to maintain good energy production. You want to avoid mitochondrial inhibitors. You want to avoid SERCA inhibitors, because if you can't manage your calcium, your cell's headed towards death. And so this is the supply and demand theory of neurodegeneration of me, Pete Rogers, okay? And that causes those brain cells to die. When a brain cell dies by apoptosis, you can't see it. It just dies slowly and it's recycled. Versus if you have a stroke, it happens suddenly and you can point to it on a brain MRI. That's where the stroke occurred, in the precentral gyrus. But with apoptosis, you just lose a few neurons here and there all over the place gradually, and the brain just keeps shrinking. And so you can't see them on a brain MRI. You just see a shrunken brain. So plant foods protect you from all that. They have high potassium, high magnesium, and plant nitrates to open up your arteries, vasodilators, okay? They're all the good stuff. When you eat processed food and you eat a lot of meat preserved or flavored with sodium, you get vasoconstriction. When you eat the fat, you get the red blood cells stuck together, dropping oxygen delivery. So that's why the vegan diet optimizes blood flow to your brain. That's why I eat it with no oils, low-fat vegan diet. It gives you antioxidants to protect you against oxidative stress, to help you deal with things like peroxynitrite and prevent problems with that. The fiber maintains your gut barrier so you don't get that neuroinflammation due to leaky blood-brain barrier and LPS, bacterial endotoxins, having access to your microglia. You don't want that. You want to avoid these stimulants, things like coffee, tea, caffeine, aspartame, the sweetener, the MSG, MFG in processed foods, cigarettes, nicotine. Avoid unnecessary psychological stress. Try to get your sleep. Don't smoke cigarettes. Don't use substance abuse, these drugs that are stimulants. Don't substance abuse any drug. Alcohol also is a major brain toxin. All right. Avoid the mitochondrial inhibitors, which means avoid processed food. Avoid unnecessary medications. I don't like putting anything on my skin either. If you have to, I've given separate talks. I don't have time to get into with sunscreens. There's some sunscreens that are safer than other ones. You got to watch out. There's a lot of weird chemicals. So I try to avoid chemical exposures unless I need them. If you need them, fine. And if you're going to be out in the sun all day, you're going to need some sunscreen. But I don't put chemicals on my body if I don't need to. I don't use deodorant, for example. I don't use shampoo. I don't have much hair anyways. But avoid fried foods. We talked about that. I won't eat anything in a powder form if I can avoid it. Especially, I would never take a protein powder. They often put heavy metals in there to make them heavier so they can sell them for more money. So those are some of the things. I avoid those estrogenic chemicals. I avoid unnecessary estrogenic chemical exposures. They're often preservatives. So I don't use personal care products, perfumes, colognes, deodorants, any of that stuff. I don't use dishwasher soap. If you don't cook with oil, you don't need dishwasher soap. These are all ways to minimize exposure to estrogenic chemicals. I don't use laundry detergent. I just wash my stuff in hot water. That's good enough. These are just a rehash of the things I talked about in my supply and demand theory. A lot of times people tell me, well, I know this guy, my uncle, he smoked and drank every day and he lived to 90. My answer to that type of question is like, imagine you had 100 blind people and they tried to cross a busy street. Some of them would make it, but that doesn't mean it's a good idea. So if you want to optimize your odds, you want to have good habits. Here's a pyramid for what I call the Spartan Vegan diet, which is basically just like very much the same as the Caldwell-Esselstyn diet or the McDougall diet, very similar to the Nathan Pritikin diet, etc. Eat plant foods, all right? And starches, I like the McDougall diet, eating primarily, especially starches to get most of your calories: potatoes, sweet potatoes, rice, beans, oatmeal, quinoa, wheat, and whatnot. Fruits are good too. I actually eat more fruits than the typical McDougall diet would be. He recommends usually people eat about 90% of their calories from starch, 5% from fruits and vegetables. I'll actually eat closer to 35, 40% of my calories from fruits. I exercise a lot. I'm 61 years of age. If you exercise a lot, you can eat more fruits. I think McDougall's concerned that people who don't exercise much, older persons, they're more prone to potentially having problems from eating too much fruits, because fruits don't satisfy hunger as well, and you can overeat them. Veggies, you get a lot of good nutrients from your vegetables. You end up taking a vitamin B12. I just take methylcobalamin. And then these are all the things that are risk factors for dementia and an early death. And we talked about them in this lecture, how to avoid them. The high-fat foods cause obesity. The processed foods cause obesity. You can look up the island of Nauru, the fattest people in the world because they eat tons of processed food, the island of Nauru. Hypertension, we talked about that. What causes that? Primarily high-fat foods and sodium, lack of plant foods, diabetes, especially high-fat foods, excessive alcohol, high fructose corn syrup. Excessive dietary salt contributes to it, but the big one is high-fat foods. Atherosclerosis, risk factors are primarily what causes these things: obesity, hypertension, diabetes. We talked about how high-protein diets, animal protein, will accelerate aging. Head trauma, bad for the brain. Excessive stress, excessive caffeine, sleep deprivation are bad. Your brain needs to sleep to clean itself, get those waste products out. Watch out for mitochondrial inhibitors. Be a minimalist as far as food, and be careful at working with chemicals. If you have to work with chemicals, open the window, ventilate the area, avoid unnecessary chemical exposures. Filter your water. I like a reverse osmosis filter in the kitchen. I like a whole house carbon filter. Again, avoid processed foods. There's way more chemicals in them than you would think. Don't use personal care products unless you need to. Like even lipstick will often have lead paint in it. Deodorants routinely have aluminum in it, which is neurotoxic. You'll also often have estrogenic preservatives in there. They both can be neurotoxic. So anyways, that's it for my slides. Hope that was helpful.
Wow. Thank you so much, Dr. Peter Rogers, for this really fascinating and super information-dense presentation.
Yeah, well, actually, plant diets help prevent against osteoporosis. The populations with the most osteoporosis are the ones that eat the most animal foods, because animal protein has a different amino acid composition than plant foods do. It has more methionine in it, for example, sulfur-containing amino acids. And part of the metabolism of those sulfur-containing amino acids is to be converted to sulfuric acid, which then causes a metabolic acidosis. The kidneys manage acid base in the body, and they excrete the hydrogen protons into the urine. But that hydrogen proton excretion is coupled to the excretion of calcium. They take that calcium both from the muscles and from the bones. So in a sense, you partially pee your bones into the toilet by eating a lot of animal protein. And that's been shown, for example, in the Eskimos, the Inuit population. They have very severe osteoporosis. And it's also interesting, if you look at the study of the Bantu population, the Bantu is the women in South Africa. They would typically have about 10 children. Before birth control, that was pretty normal for a woman to have about 10 children. And they would nurse them for about 3 years. And so that's using up a lot of their calcium resources, so to speak. And they didn't ingest much calcium. They didn't drink dairy. There's no animal in the wild that drinks the milk of another species. So the point I'm saying is they had a very low calcium intake, and they had a very high calcium output, if you will, by nursing all those babies and having all those babies. But they don't have a problem with osteoporosis. So the point I'm making is it's not a calcium dietary deficiency that primarily causes osteoporosis. Persons need to, the plant foods are good. They need to exercise, try to stay quite active if they can. And I would say avoid the animal protein to prevent osteoporosis. And like Dr. McDougall had said, there's no such thing as a dietary calcium deficiency. It's pretty abundant in the food supply. Yeah, it's a stimulant. I'm not a fan of it. In my opinion, if there was no money involved, I think there would be far less use of these psychiatric drugs. I think, for example, you can take a look at the Feingold diet. Feingold wrote a book in the 1970s, around early 1970s, about the Feingold diet for children with hyperactivity. Later on, a lot of hyperactive children got labeled with attention deficit. And he basically showed how if you minimize the food dyes and the processed food, a lot of these kids will dramatically improve. And in my opinion, they should make more effort on working in that direction. with these kids, because a lot of these foods are full of stimulants. The food's got a lot of glutamate in there, manufactured free glutamate, et cetera. And that can cause, hyperactivity in these kids as well. And you got aspartame sometimes in some of these processed foods. So I would focus on doing that. And I'm not a fan of giving stimulants to the kids, because I think over time you predispose them to excitotoxicity of their brain cells, their neurons. And very often it leads to more neurologic complications and decreased cognitive performance down the road. They often develop polypharmacy, become psych patients and stuff. And so I'm not a fan. I think they give far too many psychiatric medications to patients, both children and adults. I don't specifically know the fruitarian population. I would expect they do pretty well. I actually think our ancestors ate a lot of fruits. I think the reason why we have color vision is probably to see when fruits are ripe. But I don't specifically know. I do know, and Dr. McDougall will always say there is no such thing as a large fruitarian population in the wild. He says all healthy, large populations are starch-based. But I have seen a lot of very healthy people who eat lots of fruits. But I don't have a scientific study to say that they do better or worse. I don't like the idea of them. I think avocados, they very often, it's one of the most common fruits to be sprayed with that new preservative. It's like AP and then letters E, E, and L. And, I looked up the chem data sheets on it. It has a risk of pretty toxic contaminants. I think one was acetonitrile. It also, not to mention that, it has a tendency to have trans fats in it. And trust me, those contaminants were really bad. You look up in the chem data sheets, you won't want to ever eat it. So I would never eat avocado. Not to mention that, it also has very high amounts of fats. As I recall, its fat was like 85%, something in that ballpark. So, and in nature, that thing is only in season for about 2 weeks out of the year, but you can buy it in the store anytime you want. So to me, it sounds like a bad idea. Super high fat and covered potentially in a relatively harmful preservative. Yeah, I would avoid it, because then you got, carbonic acid. I try to avoid acidic things that can be damaging to your teeth. I'll avoid anything that's acidic, for the sake of, protecting my mouth. And that tends to be like soda pop, the carbonated soda pops. Orange juice is also very acidic too. That especially will predispose to cavities. And I definitely think you should rinse your mouth out with water after you drink stuff or you eat. At night's the most important time to floss your teeth or use a little dental brushes and clean them or brush your teeth, because at night your saliva production goes down and you're more likely to get cavities if you don't clean your mouth before you go to bed. I'm not sure exactly what causes multiple myeloma. I kind of wonder, that might be related to something called the Alan Cunningham theory of lymphoma. I'm not exactly sure if it is, but you start talking about the immune system, you start getting into a couple different things. I know high-fat diets suppress immune system function. I know omega-3 fats suppress immune function. So in general, that's why I avoid those things. You also have issues where, excessive dietary sodium can cause activation of platelets, and I don't want that either. But Alan Cunningham was talking about high meat diets, and he felt they cause hyperstimulation of the immune system, and that sometimes the immune system can't turn itself off. Dr. McDougall used to give lectures about this. It came out about 1975. It never got that widely known, but it makes sense to me. Meat eaters have higher white blood cell counts. They'll have more nonspecific causes of inflammation. They'll have more leaky gut. Leaky gut causes activation in the immune system and all the autoimmune diseases. Okay. They have higher white blood cell counts. I might have mentioned that already. They have TMAO, trimethylamine oxide. They have xenosialitis because they have sialic acids that are similar to ours, but different enough. They're similar enough that they get incorporated across our gut lining into some of our proteins, but they're different enough the immune system still recognizes them as foreign. So you get all these unnecessary immune reactions happening. There's also a lot of estrogenic chemicals given to cattle, for example, to make them grow faster. It's a fat storage hormone. And you ingest these hormones, and they can cause a little bit of overactivation of the immune system. Women tend to have a more active immune system than men do. 80% of autoimmune disease tends to occur in women. The female immune system, they tend to be less sensitive to colds and flus, but it can cause, you don't want these autoimmune type problems. So the bottom line is, I don't understand it that well. My general philosophy of disease is sort of a holistic philosophy. And what I mean by that is I try to be as healthy as possible, because I think when you're as healthy as possible, your body just avoids diseases, if you will. And it's kind of like there's an old saying, you don't have cancer because you're not sick because you have cancer. You have cancer because you're sick. Okay, I'm kind of getting at something. There was a lady doctor who used to talk a lot about that. She was a real smart lady, all right? And so what I'm trying to say is conventional Western medicine always tries to match the yield of the pill and send a bill. This is disease number 1, take this pill. Disease number 2, take this pill. Disease number 3, take this pill. Whereas what I'm saying is optimize your diet, your sleep, your exercise, your stress management so your body is as healthy as possible, and you'll find that it prevents most diseases. It's sort of an indirect way to approach things, but it actually works quite well, even though it doesn't sound as nice as in a conversation as saying disease number 1, treat with pill number 1. Yes, because if you drop your blood glucose too low, for example, if you're driving, you could pass out and crash your car. And if you drop your blood glucose too low, it's unusual just from routine rebound hypoglycemia to drop it this low, but you can deprive your brain cells of adequate glucose, and they can go into what I just described there, like an excitotoxicity effect, where they can't produce enough energy to pump the calcium out of their cytoplasm, and they get overactivated. It's rare though. I occasionally will see small stroke equivalents from hypoglycemia, but it's rare. But the kind of situation where that might occur is a diabetic person giving themselves too much insulin by accident. One of the things I worry about though is let's say you're talking about an overweight diabetic patient and they got sleep apnea. Okay, so when they're sleep apneic at night, they sometimes have done sleep studies on these patients, and I've seen them dropping their oxygen saturations into the 60s. Okay, normally the oxygen saturation should be over 90. All right. And I've seen them dropping it into the 60s. So they're hypoxic. And if you superimpose on that hypoxia, hypoglycemia, for example, or other related problems, they could lose some brain cells. So that's what I'd be worried about. I'm not a big fan of soy. I know soy is real popular. It's $1 billion commercial food and all that, but I'm not a fan of soy. It's very high in fat. It's also very estrogenic. It's like off the charts estrogenic, like 1,000 times more estrogenic than most other foods. Flax is about the only food I can think of that's more estrogenic than soy. And if you look at the old papers, the modern papers, the corporations write all these papers to promote their products. And if they see 5 bad papers about their product, they'll publish 10 papers saying their product's good. And then they'll say, well, the majority of papers say our product is good. But if you look at the old papers, you'll see papers of soy causing premature puberty. You'll see soy dropping soy testicular sperm counts. You'll see papers about it disrupting development of the female reproductive tract. So it activates secondary sex characteristics as well. And the reason I went into all of that is people will sometimes say, oh no, soy only activates the good estrogen receptors, like the beta estrogen receptors, to help prevent osteoporosis. It's good. But if you look at the Stefan Mueller paper, they're going to show you that it also activates the secondary sex characteristic type 1. So you worry about what its effect is on breast cancer. I've heard some saying it's protective, some say it's not. And a lot of times, most of the soy in the Western world is processed soy. It's not organic soy. And it's very routinely processed with hexane, which is a neurotoxin. It's routinely sprayed with glyphosate, which is a neurotoxin. That's also a liver toxin. It also predisposes to fatty liver and diabetes and the leaky gut. So I'm not that impressed by it. And then the next argument that always comes up to say, well, these Asian people, they ate a lot of soy. They were fertile. They were healthy. They tended to eat small amounts of soil, like less than 5%, that was locally grown. So, and it's not a health food, and Dr. McDougall talked about some of the problems with soy. He didn't speak as directly as I'm speaking at this moment, but he wasn't too impressed by it either. I think soy is quite overrated. I'm not impressed by it. And I don't think people need extra protein. If you look at the animal studies, the lower the amount of protein they eat, the longer they live. It's kind of like calorie restriction. Protein restriction is an easier version of that. So I'm not a big fan of any of the soy products. The kind of things I would see as being helpful to a person if they've had a recent neurologic injury would be, for example, eat adequate amounts of dietary fiber because it'll protect against leaky gut, and simultaneously that'll protect against leaky blood-brain barrier. I think a good example is that lady, Jill Bolt Taylor, who she's got a really good TED Talk called My Stroke of Insight. What did she do? She had access. She was at Harvard. She had access to all the high tech. She went to live with her mother. She would sleep in a lot. She would sleep, and I forget the number of hours a day, as much as 12, 14 hours a day. When she would wake up, she would just do a little more each day, a little more exercise, a little more of something cognitively challenging, like try to read or something. And she kept trying to just gradually keep increasing that a little bit, day by day, week by week. And she eventually made a complete recovery. So I think that's like what I would recommend: a healthy diet, a safe, supportive, low stress environment, and keep on trying to make small incremental improvements and have them all add up. And by avoiding all the bad habits, You can keep on trying to go, 2 steps up each day rather than a lot of people, they sort of halfway on their habits and they'll go up 2 steps and they'll be knocked back 1 step down, because let's say they're still drinking, smoking, or doing some other bad habit. So anyways, that would be my advice on neurological recovery. A low stress, safe environment with lots of sleep, and they constantly just try to challenge themselves a little more each day. And I would keep doing it for years. I wouldn't just do it for, 3 weeks or 3 months. I would every day try to improve a little bit.
Okay.
Oh, one thing about coffee, if you're going to quit coffee, it's good to taper it off because it's a bit of an addictive substance. And I would taper it off like about 1/4. Let's say if you drink 1 cup a day, I would drink 3/4 of a cup the next day, then half a cup, and then just a 1/4 cup, and then stop. And you'll probably have cravings for about 2 weeks, some people for a month. But then after that, because I had made the same change, I used to drink 2 cups a day for about 15 years. I was so glad to be done with it. And all my energy came back, and my afternoon, I didn't get that afternoon slump of like sort of a rebound hypoglycemia type slump you get from coffee. Oh, well, that was kind of funny. Okay, the Spartan Vegan came out of 2 things. When I was in college, I was at Stanford. I was a wrestler. I set the all-time record for victories in a season at Stanford as a wrestler. And then also, the Spartans were known for being very much minimalist. So I'm a minimalist. I just eat the healthy food. When I have to cook for myself, I'm really lazy. I just, boil my starch and I'll eat some fruits and leave it at that. I don't do anything fancy like with a bunch of spices and all this fancy details. I keep it real simple. So I'm sparse like a vegan, and also I'm kind of a little bit of a macho man in the sense of, a former athlete. And what I'm trying to say is I think athletically. I'm not trying to just get by. I'm trying to be optimally healthy and have optimal cognitive performance. I'm 61 years of age. I want to keep my brain sharp. As far as all the doctors I know, I think I'm aging the best of them, all the guys I know. I try to work out and exercise because there's a lot of the stuff about, you need more protein to work out. I don't think you do. I do plenty of squats and weightlifting. My strength is still pretty good for my age. So that's where Spartan Vegan came from, the idea of something very simple. And what I like about it is I like what Dr. McDougall said. I actually was a star McDougall that I went through his starch diet because I was fat in my 30s and I lost all the weight by switching to a starch-based diet based on the advice of Dr. McDougall. I communicated with him through emails. So that's a lot of where it came out. Because here's what Dr. McDougall said. He says, if you're in trouble, you find yourself fat and sick and you're worried, he says, all you need to do to start out is eat 90% of your calories from starch, 5% from vegetables, 5% from fruits. And then that'll get you healthy fast. And in the meantime, you can start studying the process and learn the details. But I thought that was great advice. Starch is the best food to satisfy your hunger because it's a polymer glucose. So polymer glucose wrapped in fiber. The fiber makes a low caloric density. So it stretches your stomach, early satisfaction of hunger, takes time for the enzymes in the gut to peel the fiber off. So you get slow absorption of the glucose into your blood, having the effect of like a slow release energy pill. It satisfies your hunger with the fewest number of calories, so it makes you skinnier. The lower the percentage of calories from fat, the faster you will lose weight. Rice, like white rice, potatoes, sweet potatoes, they all have only 1% of calories from fat. Lentils are the lowest fat bean. They're only 3% of calories from fat. So when you eat these low-fat diets, you'll optimize your body weight relatively quickly. You get all the healthy nutrients like fiber and the other stuff in plants. We talk about that, the potassium, the magnesium, the antioxidants and all that. And you'll start moving towards optimal health. And in the meantime, you can start reading about the details, figure out what salad you like and all that other stuff. But in terms of fast advice to get people healthy quickly, that's one of the greatest things I think about McDougall's advice. Eat the starch-based diet. Once you're pretty healthy and sophisticated, you could do more things. I know some people like Ruth Heidrich, for example. I remember her saying that she switched. She went initially McDougall, and then later on she found it convenient to eat more fruits. But she was exercising a lot, and she could do that because she then knew a lot more about the details of what she was doing. But for starting out, going starch-based can get you healthier fast. Well, treadmill's nice. I like to walk. If you have a place to walk outside, that's great. Or you can walk around your apartment or your house. Walking is a great exercise. And the other thing, too, is you can only do one motor activity at a time. You can only do one brain activity at a time. But you can do both together. For example, I would often read a book while I was walking around my house, or I'd listen to an audiobook, or I'd listen to an educational YouTube video while I'm walking around. So you can do that. You have to pick an exercise that you like to do so that you'll do it automatically. And walking is one of the best ones. Walking, you can also do it with a friend, which is nice, okay? You can jog, you can run. If you're healthy enough and you got a place, you can jog or run. That's great. The other thing I find helpful is going upstairs. I work in a hospital as a conventional doctor. And I have to go up and down the stairs quite a bit, and I always take the stairs. I consider taking the elevator for wimps. I won't ever take the elevator. And I can tell you 99% of hospital employees, they take the elevator. And so you always want to take the stairs. When I have to park somewhere, I'll often park extra far, so I make myself walk. When I have to walk, like let's say it's the end of the day, I'm done with work, I will walk as fast as I can to my car, partly because I want to go home fast, but also because I'm trying to force my body to go fast. When I always take the stairs, and that's a lot of stairs. For example, at my house, if I have to go to the bathroom, I will go to the upstairs bathroom, and I'll often have to go work in the basement, and I'll go to the upstairs bathroom. I'm constantly doing a lot of stairs. I'll often do 50 flights or more stairs in a day because it's good exercise. So I would work it in. Then it's nice to lift weights, but you might not have access to lifting weights. Then I would do isometrics. I'll do these isometric exercises, and they actually work surprisingly well. Plus also, you can do push-ups. It's very easy to do push-ups. And I keep track. I keep a little training journal that I'm constantly going up in the number of push-ups I could do. So figure out what works for you, but challenge yourself and keep a little training journal that you're always trying to progress, because that way you push yourself. It's easy to be lazy if you're doing isometrics if you don't push yourself. Well, let's say I have to work on a 10th floor. I will go up the 10th floor and I have to carry my backpack, and I'll go as fast as I can. I will push myself, okay? And I'll often have to do that 3 times a day, and I will push myself real fast every time. And that's pretty good to keep me in good shape, because I often then will sometimes go on longer walks with friends, and I'll find that I always have more endurance than they do. I always do. And I sometimes have to walk upstairs with them just because I'm in the habit of doing it every day. So that's what I'll do. I mean, I wish I had a better place to run, which I don't really have conveniently. But by just pushing myself in those moments, I find that I get a lot out of it. Like when I do push-ups, I will, on my last rep, I will hold myself, do a negative until I drop. So I'm always trying to challenge myself a little more than what I'm capable of doing, or what feels comfort, pushing beyond the comfort zone. And in so doing, you make pretty good progress.
Very good. Okay, Tom Salzberg wants to know, how about if he does 2 low-fat meals in the day, breakfast and lunch, and then 1 meal, dinner, that would include fat on a daily basis?
Well, you could do whatever you want, but again, the goal is to seek what is optimum. That's what I try to do. And I try to give you the mentality. I can tell you this, the vast majority of patients in the Western world, by the time they're 60, they're fat, sick, and stupid. Okay, and by that I mean, I'm not trying to be mean, but I'm saying is they're very cognitively slow. And what I see is it's good to have what I would consider the proper attitude. And here's what I consider the proper attitude. Thank God that there's a vegan diet, so it's not inevitable I have to become fat and sick, okay? Because most people are as they get older, over 55, over 60, and you don't want that to happen. And as far as I know, I've been a doctor over 30 years, and I've studied this stuff in great detail. I've gone through all the literature on Kempner, on McDougall, on Esselstyn, on Ornish, on Burkitt, on Pritikin, and the other ones. And I can tell you, as far as I'm aware, the best you can do, and really the only thing that works, is this low-fat vegan diet. And then you combine that with good health habits, getting your sleep, getting your exercise, managing your stress, and all those things. And so what I'm trying to say is, we also have things happening to us that are negative that we don't even know. Like, let me just show you a paper somebody gave me. I just finished reading this paper here. And the name of the paper, it's in Nature Journal. It's called Bioaccumulation of Microplastics in Human Brains at Autopsy. And they're finding tons of little plastic particles in the brains of people, and especially far more in the people that are demented. What I'm trying to say is, you're exposed to some toxic things that you don't even know it. You're exposed to some EMF that you don't even realize it through Wi-Fi and whatnot. And these things gradually add up. So my attitude is, I want to make myself as healthy as I possibly can be, so my body will be more resilient, more capable of protecting itself from irreversible effects. Plus, I look at brains and spines every day, all day long, and hearts and abdomens and stuff. And I can tell you, most people, as they age, they get calcified aorta, calcified carotid arteries in their brain, they get degenerative disc disease in their spine. So I want to avoid all that as much as I can. So what I'm trying to say is, that's why I emphasize pursue the optimal, do the best you can do. And in so doing, you'll minimize all these problems. So that's why I strive to do everything as well as I can, because in so doing, I'm trying to be more resilient to protect against problems and against unknown things I'm exposed to without even realizing it. I think that's all overrated. And I'd agree with Dr. McDougall. Dr. McDougall's written about this rather extensively. He says if you eat a low-fat vegan diet, there's plenty of omega-3 fats in that diet, and you will not be deficient in any phase of your life, including pregnancy. And part of the reason I go through that is you look at the omega-3 fats. The only two essential fats are the omega-3s and the omega-6s. Okay, there's a surprisingly good amount of them in plant foods. Other animals get them from plant foods. And they've done studies about trying to see how much fat do people need. Dr. Nathan Pritikin reviewed all the literature on fat back in the 1970s. And he wrote about people fed these limited diets, controlled diets, where they only received 0.7% of their calories from fat. And they did quite well. And that was primarily omega-6 fat. So we don't even need 1% of our fat, 1% of our calories from fat. Walter Kempner had patients eating like 2% fat and doing very well. White rice is only 1% of calories from fat. And so you can do extraordinarily well on extremely limited amounts of fat. And the body has some ability to, it can upconvert your omega-3 essential fats, a C18 fat, okay, alpha linolenic acid. It can upconvert it into the other versions of that. Another thing, too, is we can remember things from our childhood because our neurons don't turn over that much so you don't need to replace them completely. There's some synaptogenesis, of course, which I alluded to. There's a small amount of neurogenesis, which I alluded to, but we really don't need that much. And there's been other studies along those lines showing that we don't need much fat. Like look at Papua New Guinea. They ate 93% of their calories from sweet potatoes. That has only 1% of its calories from fat. Before 1970, a lot of the Asian populations were eating 90% of their calories from white rice, which has only 1% of calories from fat. And they're doing pretty good, okay? So I think this whole idea of us needing all this fat, I think it's exaggerated. Okay, so I'm smiling because that gets into a little bit of a controversy because I've heard good things about fermented foods, but I've also heard some bad things about fermented foods. Some people believe, and there's a couple papers to this effect, that they have a small increasing the risk of cancer, like gastric cancer. So there's other things I've heard positive about them, so I doubt it's that bad of a thing. I would say if you're interested in eating them, read about it yourself and decide if you want to eat it. I gave a lecture on it years ago. And the gist of the lecture was I found a whole bunch of papers saying it increased cancer risk. But now I've heard a lot of other people say positive things about it. So I personally don't eat them. But I do think that they're probably not that bad. There's always a bit of a pendulum swing saying, oh, look at this, look at the cancer issues. But there's some other good things about them. And it gets people to eat plants, which I think is good. So if I'm going to use toothpaste, I'll use one of those types that does not have fluoride in it. Fluoride has been shown to be quite neurotoxic. It's a halogen. In the vertical periodic table of elements, all of the halogens basically kill stuff, okay? Chlorine is used to sanitize water. Bromine is used to sanitize water. Iodine was used to prep patients because it's such an aggressive, bactericidal thing. Okay, even though it's also taken up into thyroid hormone. I realize that. Okay, but fluoride, it's the most electronegative chemical in the whole periodic table of elements, meaning that it very aggressively grabs electrons. It steals electrons from other molecules and it doesn't give them back. So I think it's a very toxic substance. I think it's overrated for dental protection. It has a small beneficial effect towards protecting cavities, but it has a harmful effect on the spine. It's also neurotoxic. I don't recommend it. It's an inhibitor of glycolysis, an inhibitor of Krebs cycle. It's an inhibitor of mitochondrial electron transport. There's numerous bad things about it. Okay, but once having said that, most toothpaste, they got other things in there that you don't necessarily want. For example, they'll very often have carrageenan in there, which is sort of similar to MSG. They'll very often have sodium lauryl sulfate, which is a little toxic. So when I do brush my teeth, and I sometimes do, I use a very small amount of toothpaste. This is like the size of a small pea. And I brush my teeth real quick and I rinse them out really well. Okay. I like to always use those dental brushes to clean stuff. I like the water pick, to clean my mouth off real quick at night after eating. I try to have my teeth clean before I go to bed. And what I also do is I just don't I don't eat any sweets. I don't eat anything that's carbonated, things that'll predispose to cavities. So that's how I sort of handle it. Yeah, there's a couple of things I'm interested in. I have a lot of stuff on spine. I also have a lot of stuff, just on general atherosclerosis. Currently, what I'm studying is I've been very interested in the kidney because I'm finding some overlap between the blood-brain barrier and the kidney filtration barrier. And I learned about the way that fiber is used to protect not just the blood-brain barrier and the gut barrier, but also to protect the kidney barrier. And I'm reading about diabetic nephropathy, kidney disease. And what I also learned from the kidney is our body filter to protect us. And there's a lot of thing in meat and processed food that damage the kidneys. And so the more you learn about nutrition and the different organ systems, the better this whole food plant-based diet looks. Okay. All right, well, there's a couple of things I bring up. Number one, omega-3 fats are associated with increased risk of atrial fibrillation. Atrial fibrillation is one of the most common causes of stroke. It's also a mouse equivalent, dropping perfusion to the brain. So I think omega-3s are highly overrated. I think a lot of corporate funding goes into omega-3s to try to make them look better than they are. So being associated with atrial fibrillation is a big deal. Number two, the higher the percentage of calories you eat from fat, the fatter the person gets, okay? So being obese increases your risk of hypertension and diabetes. That's also a negative. Omega-3s are also immunosuppressants, so they decrease your immune system's ability to function, increasing your risk of having infections. That's not good. They increase your risk of prostate cancer in particular. And I'm not aware of the studies, and I haven't looked for it, but usually things that increase the risk of prostate cancer increase the risk of breast cancer. I think omega-3s, something that suppresses your immune system might increase your risk of just generalized cancer. I know in animal studies it increases liver cancer and metastatic disease. So I think omega-3s are quite overrated. Quite often, too, if you look at any type of storage system, when you have a PUFA, polyunsaturated fatty acid, especially the long-chain ones like EPA and DHA, that means you're going to have more and more double bonds. You're going to have more and more methylene bridge carbons, more and more of a predisposition to lipid peroxidation. And I have seen papers to that effect, that there tends to be very high amounts of lipid peroxidation in these omega-3 supplements. And so also as there are in cooking oils. And so that's going to increase your risk of lipid peroxidation chain reaction. So I think it sounds like a bad idea. Plus, you then have to worry, too, about the idea of if it's coming from ocean source like fish and even ocean algae, what about mercury contamination? The ocean is the sewer of the world, if you will, and there tends to be problems with heavy metal and other contaminants in foods derived from the ocean. So, you might have to pay a lot of money to get one that's extra well, has all those contaminants removed. But what I'm basically saying is I agree with Dr. McDougall on it. I think they're quite overrated. And I think that a lot of the literature on them is corporate funded in the modern sense. Well, I think I'm always a big believer in try to fix the problem on your own first as best you can, and then only secondarily go to a drug. Because once you go to a drug, you run the risk of all kinds of problems, of developing tolerance to the drug and having to constantly increase the dose, developing addiction to a drug and then having withdrawal symptoms from it, of causing the body to suppress its own intrinsic production potentially, and that can lead to problems down the road. Also, there's the expense of it. There's the issue of, cross reactions with other chemicals and polypharmacy. So what I'm saying is, in my experience, people usually have not looked as diligently as they could to how to fix the problem. Like if you want to sleep better, number one, check the EMF in your house and make sure you have a low EMF in your sleeping area. Get the electronics out of your bedroom. Try to exercise during the day to build up your sleep drive, that intensity that your body wants to sleep. Eat your meals earlier in the day and avoid wet foods at night, especially for men. They got the big prostate pushing on the bladder. They have to wake up to void, and it can be hard for them to go back to sleep. So if you eat your wet foods like oatmeal or whatever else it is earlier in the day, you'll be a little bit dry at night. You won't have to wake up to void as much. That can make a difference. Have your room dark enough to help you sleep, but light enough that you can find your way to the bathroom, okay? And do all these healthy sleep habits. One of the things I've done is I have my house a little warmer at night, because when it's warm, I'll even sweat a little bit while I'm sleeping. I notice that I wake up less to void when I do that. So I do that. So you have to figure all that stuff out for yourself. But I would spend a lot of time experimenting, even keep a little, like a training journal, a sleep journal. What is helping, what is hurting? And look at your food. You want to make sure you're not eating, caffeine. Make sure you're not eating MSG or aspartame or any of these things that could be stimulants and decrease your capacity to sleep. Make sure you're not drinking any alcohol. You're not smoking any cigarettes. Any of those things can interfere with sleep. And I would study sleep. There's a guy at MedCram. I think his name is Dr. Seaholt. He's a pretty smart guy. He had done, MedCram's his YouTube channel. He had done fellowships in sleep and fellowships in pulmonary, and he gives a lot of lectures on sleep. I would watch his lectures. One thing I would tell you to watch out for, though, is there are some internet sleep experts who will say things I don't agree with. They'll say, oh, it's okay to have 1 or 2 cups of coffee. And I'll tell you why that happens, I believe. I believe that to get invited to some of the popular commercial channels, you have to promote or at least not criticize some of the popular commercial foods like coffee or something. And if you don't say coffee's okay, you don't get invited to those channels. So I'm pretty used to not getting invited anywhere. So I'll just tell you what I really think. You should avoid all caffeine because it's a major stimulant with a long half-life. And I think you don't sleep as deep Even if you sleep 6 or 8 hours, you won't sleep as deeply and you don't get as refreshing of a sleep. So I would systematically, keep a little journal of all the things that cause difficulty sleeping and avoid every single one of them as best you can. And there's little things you'll learn along the way. Some people say drinking cherry juice increases your melatonin production. Maybe it does, maybe it doesn't. You could try it, things like that. Yeah, what I would do is I would try to move whenever you can. Like let's say you injure your leg, you have a leg fracture or something. Well, then try to move your upper body when you can. And you can do things like, for example, I have a desk that can go up and down. See how my desk can go up? I don't know if you can see it moving. I got a background here, like Irish castle in my background. You can get a standing desk that can go up and down. You could use that. When I'm at work, for example, I'll stand when I'm on the phone. If you can't use your leg because you injured your leg, you can do upper body isometrics. You can move your hands or whatever. Like when I'm walking, I'll take little breaks when I'm walking, and if I'm by myself in the room, I'll walk and I'll move my arms just to get my arms moving. The reason is the more you move your body and you contract your muscles, it pumps your lymphatics. Your lymphatics are a vascular system separate from the heart, so the only pump they have is your muscles. You can increase lymph flow 10 to 30 fold just by exercising. So that's what you want to do. It makes your immune system function better. I don't know because I'm not in the habit of counseling patients on cataract surgery, but I do know a few things about it. Okay, one of the things is contact lenses. They put contact lenses in preservatives. You don't want them in thimerosal because thimerosal was a preservative that was associated with increasing the risk of cataracts. Other thing is you don't want to be drinking milk. It turns out that milk, has lactose as a sugar that's split into glucose and galactose. And some people don't have the lactase enzyme, they're milk intolerant. But there's other people, they can ingest the milk and they feel okay. But even once the milk goes into their body, they still can't handle the galactose. So yeah, they split it into glucose and galactose, but they can't handle the galactose. And the point is, galactose seems a little bit toxic to any little round thing. So it's a little bit toxic to the ovaries, thought to increase the risk of ovarian cancer. It also increases the risk of cataracts. So I would not drink any dairy. I would avoid dairy completely. The other thing is, in my earlier career, I was an imaging-guided surgeon, interventional radiologist, doing tons of procedures. I've done about 10,000 procedures. Sometimes I'll have to use fluoroscopic, radiology guidance. Other times I use ultrasound or CAT scans, whatever machine. But the reason I mention that is that can cause cataracts too, radiation exposure. Like, I wouldn't get an unnecessary dental x-ray because I worry about the radiation exposure to the eyes. And the reason I'm saying all this too, I'll just tell you a quick story. I went and had my eyes checked when I was about, 35. I'm now 61 years of age, okay? And the ophthalmologist, he's my friend. He's a really good ophthalmologist. He told me, he goes, Pete, you have mild early cataract formation on your eyes. So you want to be careful about that. You might need cataract surgery down the road. I said, okay, well, I'll just take my chances. I'm pretty careful about radiation protection. And then what I did in addition to that was all my good habits. I quit dairy and all this other stuff. I'm 61 years old now. I haven't had any change in my prescription. So, I haven't asked them to check for cataracts, but my vision's fine. There's been no change in it. So I think I also studied vision. I was kind of curious. Why do people go blind? And the most common things, I made a mnemonic for it. I call it CDAHG, C-D-A-H-G. Cataracts, diabetes, age-related macular degeneration, H for hypertension on the dog pronunciation, then G for glaucoma. And every single one of them is related to vascular disease. I mentioned the unique thing about cataracts, also a deficiency of vitamin C. Where do you get vitamin C? From eating plant foods, okay? So all these vascular disease things, you can avoid them to a large extent. So that's kind of what I was getting at earlier. If you just try to be as healthy as possible and optimize all your health habits, you're often fixing problems all over the place you don't even realize. Like you're lowering your risk of acne, you're lowering your risk of abdominal compression, abdominal pressure syndrome, and hiatal hernia and esophageal reflux. Problems all over the body, you're helping to prevent them, okay? And so that's kind of been my attitude is I'm going to try to be as healthy as I can, and hopefully that'll slow down aging and prevent these early cataracts from progressing, for example. And it seems to be working. Now, that's another thing. It's hard to turn it around because once a neuron is gone, you're not going to get that neuron back. However, I believe that a lot of people have a significant amount of neurons in what I would call the penumbra zone. I showed a slide in the talk where there was in the center was the stroke, and then all in the periphery around it was penumbra tissue that would be dysfunctional because it was, partially hypoxic in the early post-stroke phase. And then over time, you're going to find out does that tissue around the stroke, does it recover and come back to normal and become functional, or does it also become stroked out? Because I'll see patients come in, have a brain MRI, and they'll have a stroke. Let's say it's the size of, this pen, and then they'll come back later, and all of a sudden it's 3 times that size. That they will have lost their penumbra. And so what I'm saying is, you probably got some penumbra-like brain tissue. All of us have a little bit, and some people have a lot. And if you optimize your health habits, you tend to maintain all that. That's what I think you can do. So I think you can restore that type of tissue. In the heart, they'll call it hibernating myocardium or stunned myocardium. So I think you can get back some of that tissue. But brain cells that are gone, they're gone. They're not going to come back. But you save what you can save, and you try to optimize the function of the rest of it. For example, you can get neurogenesis in your substantia nigra. And, you get exercise produces brain-derived neurotropic growth factor, glycogen storage, angiogenesis, all these good things. So you can restore your neurons. It's good for Parkinson's patients to exercise. So I would try to do all those things and basically do the best I could. But I don't think you can take somebody who's got advanced stage Alzheimer and has lost a tremendous amount of brain tissue, and you can never restore them back to normal. Those memories that they had, those neurons are gone. So that's not going to come back. But I think if you catch a person with mild cognitive impairment and you optimize all their health habits, they might have a surprisingly large amount of brain tissue that was just dysfunctional that might still be savable. And you can also, slow down their progression a lot. Here's the deal with brown rice. Brown rice has got more fat in it, so it doesn't store as long. And the other thing about brown rice, it has more arsenic in it. When they sort of polish it, so to speak, to go from brown rice to white rice, they also remove more of the arsenic. Arsenic's a little bit of a tricky business. The worst was sort of like the southeastern United States, where they used to grow cotton, which was a clothing textile product, and they had boll weevil insect infestation of it, so they sprayed arsenic pesticides on it, and then it takes decades to get that out of the soil. So that was a problem. But it gets more complicated than that. They had all these chickens, and the chickens had intestinal parasites, and they gave the chickens arsenic antibiotics to treat the parasites. And they also found, the chicken stays fresh in the store longer when they give it the arsenic antibiotics. Well, then the chicken farmers sold the chicken feces to the rice farmers to grow, including a lot of the organic farmers. So that's how arsenic started getting more widespread in the rice. So you can see some companies will post it on their website what their arsenic levels are. By eating white rice, you lower the arsenic levels. By rinsing it once or twice, you lower the arsenic levels. I can tell you, Dr. McDougall thinks the whole thing's overrated. He says there's more arsenic in some other foods. He said that he's never seen an arsenic toxic patient in his life. And he worked in California and Oregon, on the West Coast, where there's a lot of people eat a lot of rice. I still eat rice about 5 days a week. I'm very happy with it, but I do get organic rice from an area that claims to be low in arsenic. I do rinse it always at least once or twice. I cook it always in reverse osmosis filtered water. I feel good. I don't have any problems with it, but I would be sensitive to it. Like if I ate a new brand of rice and I started having headaches, I would be worried about that. I would consider that potentially arsenic if that was the only new food until proven otherwise, and I would avoid it and get a different brand. So I would check it if you could. And I would also see that I would look at the brand name you're eating, and I would go to that company's website and see if they post their arsenic levels. If they don't, I would consider that a negative. I would expect that they should do that. Right. I think that toothpaste is quite overrated. And I'll sometimes use toothpaste, but I don't always use toothpaste. And I do think it's overrated. And I'll sometimes use a water pick. I'll always use the interdental brushes every night. I'll always rinse my mouth with water after eating. But yeah, it's hard to win with toothpaste. Fluoride's the worst, but there's plenty of other bad chemicals that often get put in them too. And I would get them, plastic. I don't like plastic, but I'd rather get it out of a plastic than out of an aluminum toothpaste holder container. I talked a lot about it already. I would definitely get reverse osmosis to remove it from my kitchen water filter. And you can put shower head filters, and they'll have some ability to partially remove it. So yeah, I would avoid it to the extent that was possible. For thyroid disease, the main thing is to prevent leaky gut. Leaky gut's the main predisposing risk factor for a lot of these thyroiditis conditions, things like Hashimoto's thyroiditis and Graves' thyroiditis. And then I also would, try to minimize exposure unnecessarily to halogens like fluoride. Water filter too, you then remove the excessive chlorine that you take in with that. You need some chlorine. It's normal to have chlorine in your body, but you don't want excessive amounts. It also causes a low-grade metabolic acidosis because it displaces bicarbonate from the blood, the pH buffer. I wouldn't have a bromine pool if you're swimming in a pool. That's another halogen. I'd be careful a lot of breads, bromine preservatives. The thought that these halogens can substitute out for iodine and have a little bit of that. I'd be careful with the goitrogenic foods. Soy is a little bit goitrogenic. The cruciferous vegetables are a little bit goitrogenic. So I'd be careful with that. Those are some thoughts. Yeah, I would never have cyano. You know what cyano is an abbreviation for?
Cyanide.
Yeah. I wouldn't want that. And what they tell you is, well, it's such a small amount. I'm like, I don't want any, none, not one nanogram. Okay. Yeah. And they go, well, it's more bioavailable. I don't know for sure if it really is or not. I just see no point in having that potentially accumulate at all. None. I take methylcobalamin. I get the one with the fewest number of ingredients. The other thing you got to watch out with B12 supplements, a lot of them put stevia in there. Stevia is a sweetener. I don't like stevia. It's associated with causing infertility and some other problems. And anything that does that, it's probably doing other damaging effects as well. I don't need a sweetener in a B12. I just need to take the darn thing. So I like sublingual sometimes too, because if you take something sublingual, you can absorb it directly rather than rely on your gut. Like especially some people have, intestinal problems. They might get better absorption with a sublingual than they will with a gut absorbed version. Well, decaffeinated coffee has reduced amount of caffeine, but it still has caffeine. I forget the exact amount. I've heard some people say it's about half. I don't know exactly how much, and it might vary from brand to brand, but I would say why any caffeine at all? I don't want to do anything that elevates my cortisol, my adrenaline, and my noradrenaline. Who needs it? You don't need it. And once you get used to not having coffee, like I said, you'd be glad you're done with it. It's very overrated. People get into it as a habit, like they see the older people doing it and then they want to do the same thing. And don't get me wrong, if you are totally sleep deprived and you have to make a long drive, then have that cup of coffee. It'll perk you up for that drive, but don't make it a habit every day. You'll learn once you get rid of it, you don't need it. Caffeine has all kinds of bad effects. Number one, it elevates your blood lipids. Number two, it's a vasoconstrictor. It vasoconstricts to the frontal lobes of your brain. Number three, it's an excitotoxin to your brain. It activates the NMDA receptor, so it has a stimulant effect. I don't want that. Number four, it causes insomnia, contributes to that. It elevates blood cholesterol. It does things I don't want. Well, you can use metformin. I can tell you a lot of people think it's one of the greatest drugs. I've had senior attendings tell me, they heard it increases longevity and, should they take it for longevity? And I'll just tell you my simplified look at it, okay? Metformin is an inhibitor of complex 1 of electron transport in the mitochondria. And mitochondria are fundamental to life and their energy production. So I don't want to use it. I don't want to use any drug that does anything negative to my mitochondria. Now, I know a lot of people think it's a great drug. Okay, fine. But I don't think McDougall was too enthusiastic about it either. And my attitude is anything that interferes with electron transport in the mitochondria, the proton pump of the electron mitochondria, it is fundamental to life. There's even people who believe that it was present before glycolysis was. It's so fundamental to life. The mechanism of energy production in mitochondria and eukaryotic cells, in bacterial cells with the outer plasma membrane, and in chloroplasts within plants, it's all based on a proton pump. So what I'm trying to say is it's about as fundamental to life as anything there is on the whole planet. I don't want to mess with it. I'm not sure if some short-term gain you get from metformin is really balanced by a long-term gain. I don't know. So the bottom line is I don't know, and my attitude would be, why take a chance? If I could control my diabetes by eating a low-fat diet, I would just do that. Rather than taking metformin, I would just tighten up my diet as much as I could. I would look at the Roy Taylor data. And basically, when you minimize dietary fat, you're going to minimize your chance of fatty liver. You're going to minimize the fat stored in the skeletal muscles. And you got a very good chance to reverse the diabetes. Like Dr. McDougall would say, why control diabetes with a medication when you can cure it with a low-fat vegan diet? And it's pretty routine to cure it. Kempner, he said, he cured virtually all of his type 2 diabetics. Pritikin was curing tons of his diabetics. Dr. McDougall was type 2 diabetics. He said if they can't cure it with a diet, then they don't really have type 2 diabetes. They might have type 1.5. And eventually a person loses the function of the beta cells in the pancreas to produce insulin. But I would go for the cure as best I could. And if you can't get the cure, then the next best thing is just still optimize your diet. And if you have to take a medication, make it a minimal amount. But I think over-reliance on medicine often leads to long-term, problems. I don't use any sweeteners. I avoid all of them. I think they're all bad. Aspartame is major excitotoxin. Tons of problems associated with that. Stevia is associated with infertility. Xylitol is supposed to be prothrombotic. I think erythritol is prothrombotic as well. I'd avoid all that stuff. If I had to use any sweetener, I would just use organic, like white table sugar. But I don't use any sweetener. But if I had to, that's probably what I do. That's what Kempner used to do. Yeah, I'd even want it to be organic though, because if it's, let's say it's coming from beet sugar and they're spraying and it's not organic, they could be spraying glyphosate on it or who knows what.
Thank you very much, Dr. Peter Rogers, for this fascinating and very informative presentation. Mahalo.